Zambia.
And she noticed the falling gums and teeth, bad breath, and lots of drooling. Kwame's mouth half around. Ada remembered later about a dangerous mouth disease called tongue, which mainly affects children aged 2 to 6, especially those who have had measles or malaria. Ada told her mother, who quickly sent for the health worker. After checking Kwame's mouth, the community health worker agreed that there could be signs of.
What do you mean, sir?
She explained how quickly it destroyed gums and bones in the mouth. Kwame's mother was scared. She recalled villagers believing witchcraft, but the other children were affected by the same sickness. She wondered if she and Ada could get sick too. The health worker assured her it was
So
not
what?
witchcraft and that Noma is not transmitted to others. She urged her to take Kwame to the nearest clinic immediately. At the clinic, the nurse diagnosed Noma and began treating Kwame with antibiotics. She also gave Kwame vitamins to boost his immune system. To prevent Noma, the nurse told Kwame's mother about eating a diverse, balanced diet full of nutritious fruits, vegetables, and proteins. She also emphasized brushing teeth twice daily with fluoride toothpaste and immunization against measles and malaria. The next day, Ada told her class how she helped save Kwame's life by noticing the symptoms of Noma and getting help as quickly as possible. Many children who suffer from Noma may not survive. It doesn't have to be this way. Early detection and treatment saves lives. Always check your child's mouth. If you see anything unusual, go to the nearest health facility immediately. Imagine a disease that destroys your ability to eat, speak, see, and even breathe, causing severe damage to your mouth and face. This is normal. Most cases occur in Africa, but it is also found in Asia, the Americas, and beyond. Without treatment, many normal patients may not survive. Those who do often suffer debilitating facial disfigurement and exclusion from their families and communities. It doesn't have to be this way. Norma is preventable and treatable. WHO defines Norma as a severe gangrenous disease of the mouth and face.
Ah, d'accord, vas-y.
C'est pas encore là-bas en train de. On a la connexion ici. C'est pas du personnel de code. Les codes comme ça.
During stage 3, gangrene then sets in, cutting off blood flow, destroying facial tissue. Without treatment, many people die in this stage. In stage 4, survivors face severe scarring. In the final stage, long-term effects include difficulty breathing, speaking, and eating. Some may even develop eye issues. Survivors often require reconstructive surgery and physiotherapy. Norma is diagnosed clinically. There are no diagnosis tests available. Norma can be prevented by addressing potential risk factors. These include improving oral hygiene, reducing malnutrition, ensuring access to water, sanitation, and hygiene, increasing vaccinations against associated diseases like measles and malaria. It is also important for communities to know that Noma is not caused by witchcraft. In together to combat Nomas. Since 2001, WHO in the African region has led efforts to reduce Noma cases, supporting health ministries with guidance, tools, and training. The support of partners, including German NGO Kills Action Noma, WHO has helped priority countries, mainly in West Africa, to develop and implement Noma control programs. In 2023, WHO classified Noma as a neglected tropical disease, NTD. This may lead to increased awareness, investment, funding, and a more integrated approach. No child should suffer from this preventable, treatable disease. WHO is working with partners to support companies in adopting a more integrated, people-centered approach to Noma, alongside other NTDs and key issues like oral health, nutrition, and vaccination. This includes training of community health and primary care workers on early detection, diagnosis, treatment, and referral. Community awareness campaigns to promote health, early detection, and dispel myths of Noma. Integrating Noma into national health information systems and conducting Noma screening during the mass drug administration of other NTDs, vaccination and nutrition campaigns, leveraging existing wound care and referral systems. Let's unite to improve inter and multi-sectoral collaboration to fight the root causes of Noma. Join us. Do you know, almost half of the world's population and nearly half of Africa's population is affected by oral diseases. Over the last 3 years, the African region has banned oral
You see, that's a very
gum disease, as well as tooth loss. Africa also has the highest number of normal cases, a devastating disease that causes severe tooth decay and facial disfigurement. Without treatment, many may not survive. Oral diseases are not just a health burden, but an economic one too. Africa spent nearly $3 billion on direct costs due to oral diseases, with productivity losses estimated at $5 billion. However, oral diseases are easily predictable and treatable.
Good afternoon, colleagues. Kindly give us a few minutes. We are awaiting the host minister.
Early detection and management of oral diseases at primary care facilities. Strengthen disease surveillance by including oral health in national health information systems. People must also be empowered to take charge of their own oral and general health by seeking a diverse, balanced diet, low in sugar, avoiding tobacco and alcohol, and brushing teeth twice daily with fluoride toothpaste. Oral diseases are preventable and treatable. Prioritizing oral health can help millions of people live healthier, happier lives.
Excellent.
Yes, it's
Any idea of that? Lusaka? My first year was something. When we tell us we know they know, but after you know, pharmacy against it, I'm born. You know, it's a lot. What they need is the best flowers. We are special, you know, say how can come. As long as I know, as all first year in we don't take roads, not enough. We don't know how to do it, but we have to be a lesson. You know, I'm not going to do not like it. But I'm just so you know. In past 20 years, the burden of leprosy is increased by 50%. Também coragem de dizer, mas não marca o que eles não se preocupam.やはり探しに行くと、患者さんを探しに行くという活動を強化する必要があるのではないか。There is improvements from the 2022 to 2027 when we compare this. Any idea of that? Lusaka? My first year was something. When you tell us we know they know, but after you know, pharmacy against it, I'm born. You know, it's a lot. What they need is the best flowers. We are special, you know, say how can come. As long as I know, as all first year in we don't take roads, not enough. We don't know how to do it, but we have to be a lesson. You know, I'm not going to do not like it. But I'm just so you know. In past 20 years, the burden of leprosy is increased by 50%. Também coragem de dizer, mas não marca o que eles não se preocupam.やはり探しに行くと、患者さんを探しに行くという活動を強化に。There is improvements from the 2022 to 2027 when we compare.
Intendwana isimanithi na badibana kampuni yasho nganazi inaenda hospitali inaenda kuleta kabla kunaenda kuona kwamba ile kama kasile dalao kakusile dalao ndio kenda ninyo ngilipia
quand un patient est dépisté, il ne suffit pas de le dépister, mais il faut aussi le suivre. Donc, le suivi aujourd'hui des patients se fait de manière très rapprochée. Donc, cela nous permet d'être sûr que chaque patient dépisté reçoit sa dose mensuelle. Mais cela nous permet aussi de réexaminer les patients pour prévenir une réaction.
Masuku kujenga matokeo mjini gani kwa kuzungua watu na wadi wangu siku ndio watu walifanya test na bungi atukafanya sample pia alifanyia test ya ranga
Media, mother, what? Education, and I said measurement, I said measurement.
They have challenges with maternal mortality. So they refer.
Collaboration with WHO, with funding from the Gates Foundation, brought up the mentorship program. Training really builds my skills in all aspects of care, from pregnancy, labor, and delivery as well.
The training helps us to create a role for the network within the municipality. So we have a platform where people post their cases on the refer them to us.
Mean about by now I know unless calling Russian and a fan. A question said a very unfamiliar plan such an easy and normally fan.
We are happy with the clinical mentorship program and working with partners, especially this foundation, for which we are very grateful.
The health of mothers and babies is the foundation of healthy families and communities. This is the story of Zambia's journey to ensure a healthy beginning and hopeful futures for all its mothers and children.
Our first trainer translator, they said it very right. So now we are going to be and part of life. Now one, let's younger life, you know, and Papa and one and die.
For years, Zambia struggled with high rates of maternal and newborn mortality, causing heartbreak for families and frustration for healthcare providers. However, through a commitment to change, Zambia is making significant progress. Government has emphasized on the importance of investing in maternal and newborn health services.
The delivery of quality health services for especially pregnant women has been emphasized both as a presidential priority and in our national health strategic plan. Now,
Good afternoon, colleagues. Our apologies. I kindly ask that we break for lunch for an hour and resume at 2 o'clock in this section. Announcement from the secretary. But again, we are going to break and return 2 o'clock in the same room after lunch.
Honorable Ministers, distinguished delegates, the Committee of Credentials will give the time for the meeting later once the committee has been elected. Bon appetit, enjoy your lunch. Thank you. AG, but the side event in AG, the side event that will be held on the closed door side event will be in AG 09. And launch, Eniko, can you let us know where the launch is, please?
Honorable Ministers, distinguished delegates, distinguished participants, all protocol observed. For lunch, please, first level, on the first level, the lunch is served for ministers and head of delegations. And for everybody else, for participants, it is just outside the hall, just in the hall and in front of the hall. So please proceed and go through the hall and take the elevator for the first floor for those who have a red tag, red badge. Thank you very much. During the lunchtime, there will be 3 events. First is the Credentials Committee, who will meet during this lunchtime. Then there is, after that, a joint ministerial malaria press conference. And finally, there is a special event, special lunch event on invitation in AG 09. Thank you.
States that invest in material new health services is invested in the future. This is it. Awesome.
The prioritize mental health and make sure that all financial services to ensure no mothers will die while living life.
Community leaders are actively raising awareness. Parenting women to seek essential care.
Nobody or aside say this is the Russian planning for the position. We should all of us need to if you have the application, so it's consideration of the possibilities of us to so nobody doing it like that.
The campaign prioritizes consumer care, skilled care attendants, postnatal support, and access to family planning. Yet challenges remain, especially in rural areas where we serve the country.
1, 2.
Direct electric exposed by ensuring that mothers and users are protected from potential affairs.
Bamfikile ndimolavu ine. Alikashana bamolavu.
Oui. Non.
Not to be that matters. It must be because I can put like it's the plan to then then you can use them just road. Then some drop your but I use my phone. Know that, but what I'm trying to explain is there's something that happened because we can stand in the morning. What can you actually want to thank you which is late in the portable to see the body. I'm telling you, know something. No, so when we did that, I went through that first thing that I was scared. I wanted to be a sort of then in the brand, you know, what was when I on stage, yeah, that's fine. 2 minutes. Number one, you can't see have a similar in a struggle baby, we're scared. Everyone. You want to put the top to go by me. Everyone, oh, now maybe you don't have to have a shit, you don't have to end down, using point or something. No, I'm scared. You know, I think I'm kidding about the chance that they just take the way. Something's not right. No problem, we need just for 10 minutes. Stabilize, we are very enough. Now they will children, but there's something because not knowing which it's there. It's there, so it is. Somebody sing, somebody sing, somebody cry, somebody sing, somebody sing, somebody sing, somebody cry, you don't mind, you don't mind, yes I know, you don't mind, yes I know, yes I know, yes I know. Yes, I know. Somebody sing, somebody sing, somebody sing, somebody cry, somebody sing, somebody cry, Ulumani says, tonight the job, I am Shabulava Sikanda. Sheila,
Hit boy, manza chameleon, King Pesta, Yavsana, the boss lady. Je te choisirai à chaque fois. Et pas qui au total la maman yaban. Malagé, t'es qui pour jouer. Non, la boss lady. Ah, inama. Si toi, tu connais ma faiblesse. Afsana, oye di que nalela.
Check, check, check. Check, check, check. Check.
osakumana kwimbirika ira yomwe konse amoyo ayesedwa kumtibatima zochititsa mantaye zilimbitsa mtima tifanana ndi kusiyana muzotipangitsa malira amtetekan yehayampa sikuona ngobe kulirampa maso ndiyembo tonsetimaliza ikawa
Ladies and gentlemen, may I have your attention? In the main auditorium, there was a telephone found. So if somebody is missing his telephone, then please go to the lost and found desk, which is just beside the interpretation booth. There is a desk with lost and found articles. Thank you very much.
The meeting is hereby called to order. Honorable Ministers, WHO Director General, WHO Regional Director for Africa, distinguished delegates, partners, ladies and gentlemen, good afternoon. Once again, I'd like to extend my warm welcome to you all to the 75th section of the Regional Committee for Africa. I suggest that we immediately proceed with the election of the chairperson, the vice chairpersons, and the rapporteurs. According to Rule 10 of the Rules of Procedure of the Regional Committee, the committee shall elect its officers, comprising a chairperson and 2 vice chairpersons. We will now start with the position of the chairperson. Following usual practice, and given that this meeting is being held in the Republic of Zambia, the Minister of Health for Zambia, Honorable Elijah Mushomi, is proposed for the position of chairperson. Is the proposal acceptable? I see no objection. Thank you. The Minister of Health of Zambia, Honorable Elijah Mushomi, is elected as the chairperson of the 75th section of the WHO Regional Committee for Africa by acclamation. Thank you and congratulations to the newly elected chairpersons. I now invite Honorable Elijah Mushomi, chairperson of the 75th section of the Regional Committee, to take the floor.
Thank you. Very much for electing me as the chairperson for RC 75th. Let me begin by extending my sincere thanks to the members of the Regional Committee for selecting me as the chairperson. I'm deeply honored to accept this role and delighted to welcome you all to Zambia, my country. I assure you all that I will lead the committee proceedings in a productive and efficient manner. I would like to thank the RSC, that is Regional Committee, 74th Chair, Honorable Gilbert Mukoki, for the excellent work done in presiding over the RSC 74 and the first special session of the RSC. It also gives me great pleasure to recognize and congratulate Honorable Dr. Louis Kopto for assuming the role of acting RSC 74 chair and for the excellent work done in presiding over the second special session of the regional committee. It is RSC SS2, during which we nominated WHO's new regional director for Africa. I understand that the regional director would like to express his thanks to Dr. Kopto. I call upon Dr. Janabi. You have the floor.
Honorable Ministers, distinguished delegates, as we have heard, we were privileged this past year to benefit from the leadership of two chairs, Honorable Mr. Gilbert Mokoki and Honorable Dr. Louis Mapel Poto, and I extend my sincere appreciation to both. Today, it is my special honor to recognize Dr. Mapel Poto for the responsibility she carried in presiding over the second special session of the Regional Committee, including the process that led to my own nomination as Regional Director. In gratitude for your leadership and service, I'm pleased to present you with a gavel as a token of our deep appreciation. Thank you.
Thank you and congratulations once more. Thank you, Dr. Janabi. Distinguished delegates, we will now continue with our program and elect two vice chairpersons. Elections of the vice chairpersons in accordance with the routine of the rules of procedure of Regional Committee. We shall now elect two vice chairpersons. It is proposed that person Adrian Mugugu, Honorable Minister of Health of Gabon, and Medicine, Colonel Torre, Honorable Minister of Health and Social Development of Mali, take up these offices. Are there any comments on the proposals? That's what?
French translation.
Translation.
Can we confirm that the interpreters are okay? Interpreters? Honorable Ministers, distinguished delegates, we just take a pause for 2 seconds while we ensure there is proper interpretation. Apologies.
hello.
Sincere apologize. Interpretation system is down, but meanwhile, we shall use physical or direct. We shall call for the French and the Portuguese to help us within time when we are waiting for it to be installed. Those called to come in front, please, Portuguese and French.
And the fruit.
We resume business. We ended up with the two nominees for the position of vice chairpersons. And according to Rule 10, we are supposed, according to procedure of regional committee, elect two, and two names were proposed. And we are at the stage where we're asking for comments on the two nominees. Any comments?
Excellences, Mesdames et Messieurs les ministres, conformément à l'article 10 du règlement intérieur du Comité régional de l'OMS pour l'Afrique, nous procédons à présent à l'élection des deux vice-présidents du Comité régional. Il est proposé que le professeur Adrien Mogougou, ministre gabonais de la Santé, et la médecin colonel Assa Badiolo Touré, ministre malien de la Santé et du Développement social, exercent ses fonctions. Y a-t-il des observations concernant les propositions que je viens de formuler?
Senhoras e senhores, distintos participantes, conforme a nossa agenda e de acordo com a regra 10 do regimento do Comitê Regional, vamos agora proceder com a eleição de dois vice-presidentes. Propõe-se por hora o professor Adrien Mongo e o distinto ministro da Saúde do Gabão e o senhor Hassan Balotoré, também ministro da Saúde e Desenvolvimento Social do Mali, possam assumir estas posições. Por hora, há algum comentário em torno destas propostas?
I see no comment. I see no comment.
Je vois qu'il n'y a pas d'observation.
Não há qualquer comentário.
As such, the two nominees, namely Mogoge Adrien, Honorable Minister of Health Gabon, and Honorable Medicine Colonel Torre, Honorable Minister of Health for Social Development of Mali, are declared elected vice chairpersons of the 75th session of WHO Regional Committee for Africa by acclamation.
Puisqu'il n'y a pas d'observation, je prie le comité régional de bien vouloir élire par acclamation le professeur Mogougou Adrien, ministre gabonais de la Santé, et la médecin-colonel Assa Badiolo Touré, ministre malien de la Santé et du Développement social, en qualité de vice-président de la 75e session du comité régional de l'OMS pour l'Afrique. Il en est ainsi décidé.
Não havendo comentários, peço ao Comitê Regional para eleger o professor Mogodo Adrian, o distinto Ministro da Saúde do Gabão, e Sr. Médecin Colonel Hassan Bado Touré, que é Ministro da Saúde e Desenvolvimento Social do Mali, como vice-presidentes conforme eleitos neste Comitê Regional para a África por aclamação. E é assim decidido.
I have to say that interpretation is not working. I thank you, our colleagues who have been helping us. Following the elections of the two vice chairpersons, I wish to thank you and congratulations to the new vice chairpersons. I now invite the two vice chairpersons to join the high table for the conduct of the draw. The two vice persons, please come and take up the seats. Thank you. In accordance with Rule 13 of the rules of the procedure, we will now determine by lot the order in which the two vice chairpersons will be requested to serve as chairperson should the chairperson become unable to complete his term of office.
Yes, sir.
Yes, we start there. We are determining who will be the first and second vice chairperson. Take over, just in case I collapsed and died. Since I'm a Christian, I don't believe in witchcraft.
Yeah.
Yeah, just take one. Ladies first.
Medicine, Colonel Torre, Honorable Minister of Health and Social Development of Mali. Therefore, the second becomes Adrian Mokoki. Bogoka, Honorable Minister of Health for Gabon. Thank you. We will now proceed with the election of the three rapporteurs. In accordance with Rule 15 of the rules of the procedure, we shall now elect rapporteurs. In line with the committee's practice, three rapporteurs, one for each of the three working languages, are proposed. The following are proposed as follows. 1, Cavallo from Angola as the Portuguese language rapporteur. Alenta. Dr. Alenta from Ethiopia as the English language rapporteur. Gay. Then Babika Gay from Senegal as the French language rapporteur. Are there any comments on these proposals? For and against? I see none. Are there no comments? May I ask the three regional committee to elect Mr. Cavallo from Angola, Dr. Alenta from Ethiopia, and Mr. Babka from Senegal as rapporteurs of the 5th session of the WHO Regional Committee for Africa. By acclamation, it is also decided Thank you and congratulations to the new rapporteurs. Okay, good. So we start now. Which one? Let us now move on to Agenda 3, adoption of the Regional Committee Provisional Agenda and Provisional Program of Work. We will start with adoption of Provisional Agenda as set out in the document AFR/RC 75/1. Are there any observations? Any observations? I see none. The agenda adopted. We shall now consider the provisional program of work for this session. Kindly refer to document AFR/RC75/1, Addendum 1. Our meeting will take place over the next 3 days. For each substantive agenda item, first, the Secretariat will present the document under consideration for 5 minutes. Then I will open the floor for discussion. Kindly note that for each substantive agenda item, member states' interventions are limited to 3 minutes. Let's be strict with time, limited to 3 minutes. Statements by member states from other regions, the United Nations and its specialized agencies and other regional international organizations and economic communities are limited to 2 minutes. And statements by non-state actors are limited to 1 minute. If you stammer, you don't even finish a sentence. That was on a light note. Please note that I will interrupt speakers whose interventions continue after the allotted time. Speakers should refer to the countdown timer in the meeting room. Representatives wishing to take the floor shall kindly raise their nameplates to indicate their wish to make an intervention. With respect to non-state actors, only the ones that have submitted a request to deliver a statement by deadline of 18th August will be given the floor. But they are also invited to raise their nameplate when their turn comes. After the discussion, the Secretariat will have time to reply on the issues raised. All meetings will be held in the banquet room of the Mlungushi International Conference Center. Morning meetings will begin either at 08:45 or at 09:00 a.m., depending on whether the committee or credentials is representing in this report. I would like to encourage all of you to be punctual. There will be no health break between meetings, but we invite you to take break at your convenience to get tea or coffee outside. Lunch breaks will generally be at 12 o'clock or 12 hours every day and will last for 2 hours. Kindly be informed that there will be side events every day from today until Wednesday, 27th August. Both during the lunch break and in the evening after the end of the day's meetings, except today when the government of Zambia and the regional director will host a reception. The details of each side event are found in the program of work. The day regional and on the RC75 appendix is the regional committee ready to adopt the program of work as contained in the document AFR/RC75/1. Any comment on the program of work? Any comment? I see none. I see no objection. It is so decided. We shall now proceed with agenda item 4 on the appointment of members of the Committee on Credentials. In accordance with Rule 3C of the Rules of Procedure, the Regional Committee is requested to appoint Committee on Credentials made up of the representatives of 7 member states present. The main task of this committee is to examine in closed session the credentials of the representatives of member states and report thereafter to the regional committee. In accordance with the above and taking into consideration the availability of member states, may I suggest the following 7 member states to constitute the Committee on Credentials. We have the sessions. Proposals: Botswana, Burundi, Guinea-Bissau, Lesotho, Mozambique, Niger, and Uganda. 1, 2, 3, 4, 5, 6, 7. And is this proposal accepted? Is this proposal accepted? Any objections? Any objections? I see no objection. It is so decided. The Committee on Credentials will meet today during the health break, which was supposed to be 12 hours.
Meet at the end of this session.
They said they'll meet at the end of this session for 30 minutes in room AG08 and would deliver their report tomorrow morning. This concludes our consideration of these agenda items. We will continue the proceedings of the RC 75 with the consideration of agenda item 5. Statement of the chairperson of program subcommittee. Please refer to document AFR stroke RC 75 stroke 2. Dr. Ada Okonkwo from Nigeria, chairperson of the program subcommittee. It is my pleasure to give you the floor.
Thank you very much, Chair. Good afternoon, Chairperson, honorable ministers, distinguished delegates. Permit me to align myself with the already established protocol to deliver the statement of the program subcommittee to the regional committee. The program subcommittee met virtually from 23rd to 25th of June 2025 and reviewed 10 documents, 7 of which focused on technical and public health matters of regional concern. The full document is contained in AFR/RC75/2. This summary will briefly highlight the key issues from each document. Technical and health matters. The PSC discussed the document Regional Framework for the Accelerated Implementation of the Global Oral Health Action Plan. This framework aims to ensure that 50% of the population has access to essential oral health services and to achieve a 10% reduction in oral disease prevalence by 2030. The discussion emphasized integrating oral health into primary care, implementing school-based programs, and promoting community-level task shifting to expand coverage. The PSC also reviewed the document Accelerating Progress in the Health and Well-being of Women, Children, and Adolescents by Transforming Health Systems in the African Region. The strategy advocates transforming health systems to reduce maternal and child mortality by focusing on increased investments, improved service delivery, and prioritizing adolescent health. The PSC urged targeted interventions, strengthening the health workforce, and stronger monitoring. A document titled Regional Strategy to Strengthen Rehabilitation in Health Systems 2025 to 2035 was also discussed. This strategy aims to integrate rehabilitation services into public health systems, thereby contributing to progress towards universal health coverage. Key focus areas include governance, community-level access, and assistive technologies. The PSC members highlighted the need for inclusive urban design, multi-sector collaboration, and domestic financing. The PSC discussed the document titled Framework to Advance Universal Access to Safe, Effective, and Quality Assured Blood Products in the WHO African Region 2026 to 2030. The document provides guidance on improving blood availability and safety, targeting 80% voluntary blood donation and full infection screening. Key recommendations from the PSC included conducting socio-cultural research, fostering public-private partnerships, and expanding awareness campaigns to achieve these goals. The PSC also reviews the document addressing threats and galvanizing collective action to meet the 2030 malaria targets, which aims to unite efforts towards meeting the 2030 targets for malaria control. The PSC emphasized the importance of scaling up vaccination efforts, increasing domestic financing, strengthening intersectoral coordination, and leveraging AI-based surveillance technologies. A framework on the status of public health and emergency workforce in Africa was also to address the region's health worker gap. Recommendations included investing in digital tools, expanding simulation-based training, enhancing workforce retention, and integrating public health teams more effectively into emergency frameworks. The PSC also reviewed the technical paper, Strengthening Africa's Health Security, Enhancing Event Detection, Building Resilient Systems, and Fostering Strategic Partnerships, which advocates for improved detection, resilient systems, and the establishment of strategic partnerships. Key recommendations included accelerating the rollout of integrated disease surveillance and response, IDSR, investing in community and genomic surveillance, and leveraging artificial intelligence and domestic financing. The PSC recommended all revised technical documents for adoption by the 75th Regional Committee. Proposals for the designation of member states on committees that require representation from the African region was also considered, including the reconstitution of the Monitoring Committee for the African Public Health Emergency Fund. The chairperson of the Regional Committee will provide additional details on each of the proposed decision points that the PSC recommended for adoption. Regarding the accreditation of regional non-state actors not in official relations with WHO to participate in the sessions of the Regional Committee, The PSC recommended 5 new organizations for accreditation and renewal of 3 others. The PSC further recommended discontinuation of accreditation of 2 organizations. The program subcommittee reviewed the document titled Criteria for Selection of a Member State Desirous of Hosting a Session of the Regional Committee. The document addresses the need to formalize and streamline the process by which member states of the WHO African region can express interests and be selected to host regional committee sessions. This was recommended for adoption by the regional committee. Lastly, the program subcommittee members requested and received briefings on additional items, including updates on resource mobilization in the context of a changing financial landscape, as well as the progress on the local production of medical products within the region. In conclusion, I wish to express my appreciation to all the PSC members for their hard work and commitment, and also thank the Secretariat for all the support. Thank you very much, Chairperson. Over.
Just to sit a bit there. Yeah, to sit. Thank you, Dr. Ada Okonko. We also thank the program subcommittee for its diligence in conducting the preparatory work on behalf of the regional committee. Are there any observations on this report? Any observations in the country on the report submitted? None? Yes, which country is that? Togo, you have the floor.
Monsieur le Président, Monsieur le Directeur régional, le Togo remercie le secrétariat pour la qualité du rapport du sous-comité du programme. Nous félicitons la présidente du sous-comité du programme et ses membres pour la pertinence de leur analyse et les orientations données au comité régional. Le Togo se réjouit du travail abattu par les membres du PSC et des résultats obtenus avec l'examen des divers documents, dont 7 portant sur les questions de santé publique d'intérêt régional. Il s'est agi, entre autres, de l'examen des documents stratégiques sur la santé bucco-dentaire, la santé et le bien-être de la mère, des enfants et des adolescents, le renforcement de la réadaptation dans les systèmes de santé de 2025 à 2035 et l'accès universel aux produits sanguins. Le Togo salue l'examen du document sur les critères de sélection des États membres, souhaitant accueillir une session du comité régional qui répond à la nécessité d'officialiser et de rationaliser le processus par lequel les États membres de la région africaine de l'OMS peuvent manifester leur intérêt et être sélectionnés pour accueillir les sessions du comité régional. Le Togo appelle à l'accélération des progrès en matière de la santé bucco-dentaire.
Progress in the area of oral health and the health of women and adolescents, also to strengthen health systems across the board so that they become more efficient and have quality. And this obviously needs sustained efforts by member states. We would like to encourage the implementation of these documents, and we need to continue to reflect on them very much in all our regions. Thank you very much, Mr. Chair.
Thank you, Togo. Any other intervention? Seychelles, you have the floor.
Seychelles.
Thank you, Mr. Chairman. The delegation of Seychelles would like to thank the program subcommittee for nominating the Minister of Finance of Seychelles to be member of the monitoring committee. we will transmit this information to the capital as soon as possible. Thank you.
Mauritius, you have the floor. Then followed by Ghana in that order.
Yes. His Excellency Honorable Elijah Machuna, President of the session. His Excellency the Regional Director for Africa Region, Dr. Mohammed Yakub Janabi, Excellencies. On behalf of the Republic of Mauritius and the Honorable Minister of Health, allow me to congratulate Dr. Mohammed Yakub Janabi on his election as the WHO Regional Director for African Region. We are confident that your visionary leadership will share and be decisive for the WHO Regional Office for Africa. And we commend the WHO Regional Office for Africa for its strategic leadership and resilience in navigating the dear financial complexities. On the oral health, I would like to just make a few points. Several projects have been put in place in line with the National Action Plan in Oral Health 2022-2027, namely enhancement of oral health awareness, reduction in prevalence of oral diseases through prevention and curative measures, strengthening collaboration with stakeholders in the implementation of oral health initiatives, and lastly, ensure equitable access to oral health care services. In this view of the advancement made by Mauritius, we are now in a position to share our success story and experience as well as lessons learned with other African countries. Thank you for listening. Thank you, Chair.
That's good.
Thank you, Mr. Chair. On behalf of Ghana, I would like to say thank you to all members in this room. Mr. Chair, Ghana, thank you for the opportunity to take the floor to comment on agenda item 5, statement of the chairperson of the program subcommittee to the regional committee. On behalf of the government of Ghana, I extend my appreciation to the program subcommittee for its rigorous and inclusive review of key public health documents that will shape the future of health in our region. Ghana is honored to serve on the subcommittee and to contribute to the development of frameworks that reflects our shared commitment to equity, resilience, and innovation. We commend the subcommittee's work on the regional framework of oral health, which rightly elevates oral health as a critical yet neglected component of universal health coverage. We support the call for integration into primary health care, school health programs, and national budgets, and we are committed to advancing these priorities in Ghana. The document on accelerating progress in the health and well-being of men, children, and adolescents resonates deeply with our national agenda. Ghana recognizes the urgent need to strengthen sexual and reproductive health services, reduce adolescent death rates, and improve maternal and child health outcomes. We endorse the strategic flagship proposed and emphasize the importance of community engagement and multi-sectoral collaboration. We also welcome the regional strategy on rehabilitation, which addresses a growing need across our population. Ghana supports the integration of rehabilitation services and into essential health packages and calls for increased investment in workforce development and assistive technologies. The framework for universal access to safe blood products is timely and vital. Ghana is committed to improving blood safety and availability, and we support the use of innovative technologies such as drones and AI to enhance access and efficiency. We also echo the subcommittee's recommendation to explore public-private partnerships and culturally sensitive community sensitization. On malaria, we acknowledge the sovereign data and the urgent need for coordinated action. Ghana supports the proposed priorities, including the expansion of malaria vaccination increased domestic funding, and the use of predictive technologies to prevent outbreak. We also call for stronger support to national public health institutes and emergency response mechanisms. The document on public health and emergency workforce highlights a critical gap. Ghana is actively investing in health workforce development and supports the integration of digital tools, structured career pathways, and regional mobility frameworks. We also advocate for the recognition and integration of emergency medical teams and surge capacity into national systems. We commend the strategic focus on strengthening Africans' health security. Especially considering increased public health emergencies. Ghana supports the rollout of third edition of IDSR, the adaptation of One Health framework, and the expansion of genomic surveillance. We also call for sustained investment in local system and cross-border coordination. Finally, Mr. Chair, Ghana welcomes the formalization of criteria for hosting regional committee sessions, which promotes transparency, equity, and regional solidarity. We are honored to be designated as chair of Committee B for the upcoming World Health Assembly and pledge to represent the region with diligence and integrity. Let us move forward with unity, purpose, and resolve. Thank you.
Zambia, take the floor. Please, let's observe time. Otherwise, we shall be here all night. Gambia.
Yeah, thank you very much, Mr. Chair. And the Gambia congratulates you on assuming the chairmanship of this C75. And we equally congratulate all the other office holders, and we wish you successful tenure.
Thank you.
We thank the program subcommittee for this wonderful work. It's a lot of hard work, and we commend you, the entire team, and the Secretariat for supporting you. The Gambia acknowledges the report presented before us, highlighting the progress made in implementing the Regional Oral Health Strategy 2016 to 2025. We thank the subcommittee compiling the comprehensive report. We also note and concur with the challenges regarding oral health highlighted in this report. In spite of our specific challenges, the Gambia has initiated measures centering on building the health system capacity to managing and improving on oral health situation in the country. Oral health is integrated into the general health care services, but we do face human resource challenges. Under the national efforts for tobacco and alcohol control, the government is working on addressing some of the risk factors for oral health. In addition to that, we are on the verge of establishing an oral health program under the Directorate of Health Services to give focus to the challenges and to ensure that we are able to implement the oral health strategies. On a more general note, much is required to strengthen oral health in the region. We would like the WHO to continue supporting member states in building our systems to integrate people-centered oral health services, particularly at the primary healthcare level, by incorporating oral health services into benefits packages, strengthening human resources, and ensuring the availability of essential dental preparations. Thank you very much.
Nigeria.
Thank you, Chair. Nigeria is honored to have shared the program subcommittee with this report. We congratulate the committee for a good job, and particularly we commend the regional strategy on oral health, which will help in the member countries to be able to foster the integration of oral health care to our primary health care services across the continent. We particularly note the discussion on the criteria for hosting regional meetings to ensure equity and effective participation of member countries in hosting such meetings in the future. And we also welcome the scale-up recommendation of the malaria vaccine. As you know, Nigeria is one of the countries that rolled out the malaria vaccine last year, and we are still moving on with its use in the country. The recommendation on application or introduction of digital tools at the primary healthcare level is also welcome. And we urge WHO to continue to support member countries in ensuring that we accelerate our move towards universal health coverage. Congratulations to the PSC members. Thank you.
Senegal. Senegal.
Merci beaucoup.
Thank you very much.
Merci beaucoup, Monsieur le Président.
Thank you, Chair, ladies and gentlemen, honorable ministers, regional director, distinguished delegates. Allow me first and foremost to thank the government and the people of Zambia for their warm hospitality and welcome. I would like to congratulate the chair of the program subcommittee for the presentation of a brilliant report and for the pertinence of the topics discussed. On behalf of the government of Senegal, I would like to congratulate Professor Dr. Janabi on his regional director and to push forward with the health agenda in Africa. We would also like to thank Dr. Ikwaku for being the acting regional director. The program Senegal has achieved considerable progress in several key areas. In 2024, Senegal undertook their second steps in the area of oral health. And on the basis of that survey, we have been able to use a multi-sectoral approach to make better progress in oral health. We have also been able to achieve maturity level 3, and as a result of that, we have come up with an important pharmaceutical program, and this is supported by the state of the head of state, and this is really helping us in our mission in Africa. Senegal has also undertaken strengthens to improve their blood transfusion services at the regional level, and also to better
Au titre de la gestion des urgences, notre pays réaffirme sa collaboration avec l'ensemble des États membres suite à la certification par l'OMS de l'équipe médicale d'urgence, en plus du hub des urgences de l'OMS installé à Dakar pour des réponses plus précoces et mieux appropriées. Toutefois, en vue de réaliser la vision du nouveau directeur régional, qui est de construire ensemble une Afrique en meilleure santé, les défis suivants doivent être relevés. Augmenter les ressources endogènes pour le financement de la santé, intégrer les conséquences des changements climatiques dans la formulation des politiques, améliorer la gestion des données sanitaires à des fins de gestion, disponibilité et répartition équitable des ressources humaines qualifiées, améliorer la coordination multisectorielle.
Multisectoral collaboration. Finally, we would like to take note of this report and we would like to support the implementation of the recommendations found therein. Thank you.
Guinea-Bissau.
Now,
Guinea-Bissau, you have the floor.
Guinea-Bissau, you have the floor. I'm sorry, I'm getting the French again.
No sound. There is no sound, we can't hear. Could we use the mic on the next?
Okay. Obrigado.
Yeah.
Thank you very much.
Obrigado, Sr. Presidente.
Thank you, Mr. Chairman. Guinea-Bissau would like to add their voice at this session of the 17th session of the Regional Committee in congratulating you for the holding of this meeting and also for the hospitality we have received from Zambia. Guinea-Bissau would like to commend the nominees and those who are carrying out office bearing roles within the organization. We do agree that important issues have been selected, focusing on the quality of health programs. And as a result of that, we hope that we can find a better way forward in order to improve the health quality and standards of our populations, particularly in the area of oral health and in the area of improving the health of women, adolescents, and so on. We do, in fact, wish to achieve our objectives as rapidly as quickly, and to that end, we need to work together in a synergistic way in order to achieve these objectives. And this is our expectations. We do hope that we can count on the solidarity of all our brothers and sisters in Africa, because we know that life is essential for our countries and for our people. And we would like to wish this regional committee fruitful deliberations so that we can ensure that our communities and popularity of populations will prosper on our own steam rather than depending on others. Thank you.
Thank you for the observations. Please, is the committee ready to take note of the report of the program subcommittee? I see no objection. The report is noted. Is the committee ready to adopt a decision approving the accreditation of regional non-state actors not in official relations with WHO to participate in the WHO Regional Committee for Africa, as set out in the Annex 1 of document AFR/RC 75/5? Any comments? Any comments? The decision is hereby adopted. Is the committee ready to adopt a decision approving the criteria for selection of a member state desirous to host a session of the regional committee as set out in the annex of document AFR/RC 75/2? I see no comments. The decision is hereby adopted. Distinguished delegates, we will now proceed to consider the proposals from the program subcommittee for the designation of a member states on committees that require representation from the African region, as recommended by the program subcommittee in the statement of the chairperson of the program subcommittee. Please refer to paragraphs 32 to 42 of document AFR/RC 75/2. In accordance with resolution AFR/RC 54/R11, which decided arrangements to be followed in putting forward each year the member states of the African region for election by the Youth Assembly, it is proposed as follows. With regard to the membership of the program subcommittee, the terms of Burundi, Eswatini, Nigeria, Sao Tome and Principe, Sierra Leone, and Tanzania will come to an end at the 75th session of the Regional Committee. for Africa. It is therefore proposed that they will be replaced by Botswana, Ethiopia, Guinea-Bissau, Madagascar, Rwanda, and Zambia. The full membership of the program subcommittee will therefore be composed of the following member states. Region 1, Sub-Region 1, Algeria, Benin, Burkina Faso, Ghana, Guinea-Bissau, and the Gambia. Sub-Region 2, Gabon, Kenya, Equatorial Guinea, Chad, Ethiopia, and Rwanda. Sub-Region 3, Zambia, Angola, Malawi, Mauritius, Botswana, Madagascar. Are there any comments on the suggested proposals? Are there any comments on the suggested proposals? I see no comments. The decision as proposed is here adopted. Next, we'll consider the proposals for member states of the African region to serve on the executive board and in posts of the executive board. The term of office of Togo, Cameroon, Comoros, and Lesotho will end with the closing of the 79th World Health Assembly in May 2026. Cote d'Ivoire, Guinea, Mozambique, and South Sudan are proposed to replace Togo, Cameroon, Comoros, and Lesotho in serving on the executive board, starting with 159 session in May 2026. Immediately after the 79 World Health Assembly, the executive board would therefore be composed of the following member states of African region. Sub-Region 1, Compared, Cote d'Ivoire, and Guinea. Sub-Region 2, Central African Republic, South Sudan. Sub-Region 3, Zimbabwe, Mozambique. Cote d'Ivoire is proposed for election to serve as vice chair of the executive board as from the 159 session of the executive board. Cape Verde is proposed for appointment to replace Comoros to serve on the program budget administration committee from the 159 session of the executive board. The PBAC would therefore be composed of Zimbabwe and Cape Verde from the African region. Mozambique is proposed for appointment to replace Togo to serve as the Standing Committee on Health Emergency Prevention, Preparedness and Response from 159 session of Executive Board. The Standing Committee would therefore be composed of Togo and Central African Republic from the African region. Are there any comments on the suggested proposals? Are there any comments? If there are no comments, I would like to suggest that we adopt the decision as proposed. Decision proposed. With respect to proposal for officers of the 79th session of World Health Assembly, it is proposed that I, the chairman of the 79th 5th session of the Regional Committee for Africa, being nominated for election as Vice President of the 79th session of World Health Assembly to be held in May 2026. With regard to the committees of the Assembly and based on the English alphabetical order and sub-region geographic grouping, it is proposed as follows. Uganda for election to serve as rapporteur of Committee A. In B, Ghana for election as chair of Committee B. C, South Africa, Sierra Leone, Kenya, and United Republic of Tanzania for election to serve on the General Committee. D, Senegal, Sao Tome and Principe, and Eswatini for election to serve on the Committee on Credentials. In this respect, I would like to remind you that persons proposed as officers of the Assembly and the Executive Board must be part of their country's delegation, be present on the opening day, and remain in Geneva until the end of the session. Member states are encouraged to take gender balance into consideration when proposing officers and presiding officers for governing body meetings. Any comments? Any comments on the proposals? The decision as proposed is hereby adopted. Regarding the special program of research, development and research training in human reproduction, membership category 2 of the Policy and Coordination Committee, PCC, the terms of office of Senegal, Seychelles will come to an end on the 31st December 2025. In accordance with the English alphabetical order, it is proposed that they be replaced by South Sudan and Togo for a period of 3 years with effect from 1st January 2026 to 31st December 2028. So South Sudan and Togo will thus join Sierra Leone, South Africa on the Policy and Coordination Committee. Are there any comments on the suggested proposals? Are there any comments on the suggested proposals? I see no comments. The decision as proposed is hereby adopted. We will now consider membership of Tropical Disease TDARA Joint Coordinating Board. The term of office of Burkina Faso on the TDARA Joint Coordinating Board will expire on the 31st December 2025. In accordance with paragraph 2.2.3 of the TDARA Memorandum of Understanding, Burkina Faso has reapplied for membership on the JCB starting in 2026. It is proposed that Burkina Faso represent the African region for a 4-year term beginning on 1st January 2026. Are there any comments on the suggested proposals? Are there any comments on the suggested proposals? If there are no comments, I would like to suggest that we adopt the decision as proposed. Decision taken. Finally, with respect to the Monitoring Committee of African Public Health Emergency Fund. The term of office of the last MCF ended in 2015. It is proposed to reconstitute the Monitoring Committee in accordance with Section 2.3 of the HAF Operations Manual to revitalize the fund and boost oversight. In accordance with the WHO sub-regions in resolution AFR/RC 54/R11, the foreign countries and ministers are proposed for nomination by the 75th Regional Committee. 1. Burkina Faso, Minister of Finance. Cabo Verde, Minister of Health. Eritrea, Minister of Health. Kenya, Minister of Finance. Angola, Minister of Health. Seychelles, Minister of Finance. The proposed term of service is 2 years, with the members serving only one term. Are there any comments on the submitted proposal? If there are no comments, I suggest that we adopt the decision as proposed. I see Seychelles. You have the floor.
Thank you, Mr. Chairman. I'd like to reiterate the appreciation of Seychelles for the nomination to this committee, and we will transmit this information to the Ministry of Finance. I thank you.
You're welcome. Any further comments? Any further comments? Since there are no further comments, I suggest that we adopt the decision as proposed. Decision to take it. That concludes our consideration of agenda item 5. Distinguished delegates, we shall now move to the consideration of agenda item 6, annual report of the regional director on the works of WHO in the African region. Please refer to document AFR/RC/75/3. I invite the regional director, Dr. Mohamed Jakub Janabi, to present his first report to the regional committee. Doctor, you have the floor.
Slides, please. Good afternoon, Chairperson, honorable ministers, and distinguished delegates. Again, it's my privilege to present the WHO Regional Director's Annual Report for Africa, covering July 2024 to July 2025. This report reflects not only our activities, but the resilience, innovation, and solidarity that defined our collective response to an extraordinary year. This year tested our systems, our partnership, and our resolve. We faced an historic funding crisis, navigated 3 leaderships, transitions, and responded to over 160 public health emergencies. Yet, through it all, we stood firm. I want to honor the leadership of Dr. Mastushito Moeti and the interim stewardship of Dr. Chikwe Kwehezu, whose legacies continue to guide our work. Today, I reaffirm WHO's unwavering commitment to Africa and to building stronger, fairer, and more resilient systems. Our report is structured around 4 strategic pillars. First, scaling up universal health coverage, ensuring essential services reaches everyone. The second one is strengthening emergency preparedness and response, so countries can act swiftly in times of crisis. Third, building a healthier population by promoting nutritional, mental health, and well-being. And fourth, reinforcing leadership, innovation, and systems resilience. These pillars reflect our progressive and our priorities and our shared vision for the health in Africa. In the past year, WHO supported member states in responding to over 160 emergencies, from cholera and flooding to displacement and viral outbreaks. We deployed surge teams, strengthened surveillance, and coordinated rapid response. At the same time, we safeguarded essential services like immunization and maternal care. Despite financial pressures, we maintain the core programs and mobilize $66 million through the Africa Investment Round. Digital transformation accelerated with AI-assisted diagnostic and real-time dashboards. This year proved that leadership, innovation, and solidarity are the foundation of public health resilience. When it comes to immunization, immunization still remains the bedrock of universal health coverage. Over 221 million children were protected through polio campaigns in 24 countries. 107 million received measles vaccines in 21 countries. We also introduced the malaria vaccine in 19 countries, reaching over 600,000 children. This is more than a scientific breakthrough. It's a promise of survival and hope. As we look ahead, immunization must continue to anchor our efforts to achieve our health equity. 17 countries adopted WHO Essential NCD Service Package. The PEN Plus model expanded to 20 countries. Community-based approaches like the WICS projects reached over 1,700 women, integrating maternal health, family planning, and mental health. We also saw progress in regulating risk factors through taxes on tobacco, alcohol, and sugary drinks. And we celebrated Botswana Gold Tier validation for eliminating mother-to-child HIV transmission, a powerful symbol of Africa determination. scaling up UHC with a very strong regulation and a skilled workforce are essential for UHC. 33 countries advanced medicine regulation. 7 in this reporting year achieved maturity level 3, ensuring medicines meet international standard. 36 countries improved health workforce strategies from recruitment to retention. When regulation and workforce capacity align, countries build resilient supply chains, improve public trust, and guarantee consistent access to essential medicines and services. What challenges did we face here? While we've made an encouraging progress towards universal health coverage, the path remains steep. Many countries continue to operate in fragile contexts where conflict and humanitarian crises disrupt health services and erode trust. Africa still relies heavily on imported vaccines and medicines, leaving us vulnerable to global supply shocks and inequalities. Financing remains a persistent bottleneck. Domestic contribution often falls short, and over-reliance on external funding undermines the long-term sustainability. And perhaps most critical, our health workforce, our greatest asset, is overstretched and under-supported. These challenges are real. I've seen them, but they are not insurmountable. To overcome these barriers, we must act decisively. Expanding pooled procurement can reduce cost and improve access to essential diagnostic. Strengthening surveillance and regulatory capacity will help us detect threats early and respond effectively. We still have countries who, like polio, we have found orphan viruses, meaning our surveillance has to be increased. Technology, from digital health records to artificial intelligence, can bridge service gaps and extend care to underserved communities. But innovation must be matched by investment. We need sustained support for local manufacturing, sustainable financing models, and fair workforce development. The past year has shown us that with strong policies and bold innovation and meaningful progress is possible, and even with limited resources can be done. Let me now turn to emergency preparedness and response, a defining test of our collective resilience. In 2024 to 2025, WHO supported countries through 168 public health emergencies, from cholera and floods to displacement and viral hemorrhagic fevers. We monitored 88 public health events and responded to 5 level 3 emergencies. More than 400 experts were deployed, 2,300 responders trained through the surge, achieving 77% of our training target in building a skilled African emergency workforce. All 47 member states submitted IHR state party reports. 34 completed the second joint external evaluation, critical tools for identifying systems gaps. 10 countries adopted the WHO PRET framework, shifting toward all hazard preparedness. At the African investment round, as I said earlier, $66 million were pledged for health security. Ethiopia's response to a major cholera outbreak, cutting fatalities by 1/3, is a powerful example of what early detection and system support can achieve. This, Excellencies, is not just numbers. They represent lives protected, systems strengthened, and future preserved. Preparedness always, and I have to insist, always saves lives. During the review period, over 100,000 frontline health workers were vaccinated against Ebola. More than 13 million people across 8 countries received oral cholera vaccine. Uganda rapidly contained its 6th Ebola outbreak in just 87 days, thanks to early detection, innovation, and strong community mobilization. I have to underscore here that earlier you detect, the earlier you respond, the more funds you save. We also contained 3 viral hemorrhagic fever outbreaks with 0 cross-border spread, a testament to a coordinated response. Our supply systems delivered over $5 million emergency goods to 39 countries within just 3 days of request. 26 countries developed or updated national infection prevention and control plans, safeguarding both patients and health workers. And 6 countries established genomic surveillance labs critical for detecting emerging variants. These are the dividends of preparedness, and they must be sustained. A healthier population, Your Excellencies. Health is not only about treating illness, it's about prevention, dignity, and well-being. This year, 5 countries eliminated at least 1 neglected tropical disease, thanks to a strong community engagement. 28 countries updated or implemented nutritional action plans. In Burkina Faso, WHO supported the expansion of nutrition services to 120 crisis-affected sites, reaching over 50,000 people with support for malnutrition and gender-based violence. Mental health was integrated into primary health care in 27 countries, with thousands of health workers trained in psychological first aid. Sexual and reproductive health services expanded, and adolescents' health initiatives gained momentum. School health programs promoted healthy diets, physical activity, and safe learning environments. These efforts show that healthier populations are built not only in the clinics, not only in the hospital, not only in the dispensary, but in schools, communities, and families. Resilient health systems require leadership, innovation, and national ownership. Over the past year, 31 countries aligned with the country cooperation strategies with national health goals, enhancing focus and coordination. Governance reforms advanced with new ethics frameworks, improving transparency and accountability. Countries like Sao Tome, Principe, launched the first national health financing strategies with WHO support. The African Investment Round signaled a shift towards domestic financing and political commitment. African voices played a key role in shaping the global pandemic agreement, championing equity and sovereignty. Digital transformation scaled rapidly, AI diagnostics, electronic registries, and telemedicine extended care to remote communities. In 42 countries, real-time health information system improved decision-making. WHO internal reforms also progress, boosting efficiency and accountability. Sustaining these gains means empowering national institutions, expanding digital tools, and embedding transparency. Because true leadership is not just about steering changes, it's about enabling self-reliant systems that endure. Excellencies, colleagues, partners, and friends, this past year has truly tested our collective resolve. Yet, despite financial constraints and geopolitical instability, WHO African region sustained operation across all 47 member states countries. Emergency responses never faltered. Technical support reached each and every member state when required. Core programs adapted with agility without compromising on quality or equity. Progress was not just aspirational, it was tangible. We saw gains in universal health coverage, immunization, outbreak containment, and health system reform, even in the most fragile context. Most notable, we witness a shift in political momentum from dependency to reliance, highlighting the power and promise of African-led solutions. They're our problems, we have to solve them. As we look ahead, three imperatives must guide us. First, equity must remain our compass. The second one, domestic financing must echo our systems. Third, innovation and data must drive delivery. We must have evidence-based medicine. We must practice evidence-based medicine. Above all, people must remain at our heart of every action we take. The road ahead, Your Excellencies, demands a deeper and deeper collaboration, stronger alignment, and shared accountability. WHO stands ready to support integrated, people-centered health system across the region with resolve, with partnership, and with purpose. In closing, I extend my heartfelt thanks to all member states, to WHO staff, and our national and international partners. I also wish to honor the contribution of my predecessors, Dr. Moet and Dr. Chikwe, who is here physically. Thank you. Whose leadership laid the foundation for our continued progress. I cannot finish without thanking our Director General, DG, since I took office, you have been supportive. I've been consulting you. Sometimes I call you at awkward hours, but you always respond. Our work is far from over, but together we are building systems that will endure, led by Africa for Africa. Let us continue striving for a region where every person has the opportunity to live a longer, healthy, and dignified life. On behalf of the WHO Regional Office for Africa, thank you. I look forward to our continued collaboration, our shared action, and the progress we will achieve together. Merci beaucoup.
Thank you, Dr. Janabi. The floor is now open for comments from member states on the regional director's presentation. Wow, overwhelming. Zimbabwe.
Thank you very much, Chairman. I want to thank our regional director for that very comprehensive statement. Distinguished delegates, Zimbabwe fully aligns with the priorities you have just outlined. Allow me to briefly share some of our progress and priorities as we move towards universal health coverage and sustainable development goals. Zimbabwe has placed sustainable financing at the center of our health reforms. We have increased our health budget from 9.82% in 2023 to 13.1% in 2025, bringing us closer to the 15% Abuja Declaration target. In addition, we have pioneered innovative financing mechanisms such as our AIDS levy, which has sustained the HIV response and enabled Zimbabwe to achieve the UN AIDS 95 targets ahead of the 2025 deadline. We are also advancing a national health insurance scheme funded through earmarked taxes and levies to expand access to essential services and protect citizens from catastrophic out-of-pocket costs. On human resources for health, Zimbabwe is implementing its health workforce strategy and investment case to strengthen numbers, skills, and equitable distribution of health workers across the country. To improve health security, we are establishing a National Institute of Public Health, which will enhance surveillance, preparedness, and response to outbreaks and emergencies. We also recognize the importance of local production and regional self-sufficiency. Zimbabwe is investing in the local manufacturing of medicines, diagnostics, and vaccines, while working with regional partners to reduce reliance on imports. Finally, we are rejuvenating primary health care, scaling up community health worker programs, and leveraging digital technologies to bring essential services closer to the people. In conclusion, Zimbabwe remains firmly committed to sustainable financing, resilient systems, and regional solidarity. We will continue working with WHO, fellow member states, and partners to ensure that Africa's health agenda delivers tangible results for our people. I thank you.
Tanzania.
Thank you, Chair. On behalf of the United Republic of Tanzania, I wish to express that the United Republic of Tanzania congratulates the Secretariat for the comprehensive report presented and warmly welcome Professor Mohamed Janabi as the new Regional Director. We commend all the 47 member states for their active participation in the selection process. Chairperson, Tanzania acknowledges the solidarity shown by the member states in advancing pandemic agreement negotiations, an important step toward collective health, security, and equity. Also, the active participation of the ongoing discussions and the developing annex for the Article 12 of the Pandemic Treaty that focus on pathogen access and the benefit sharing system through the coordination of intergovernmental working group. We further appreciate WHO's continued technical support in strengthening our health systems, particularly in public health threats, preparedness and response, maternal and child health care outcome, and the key assessments like the joint external evaluation. We urge all member states to maintain a national ownership and accountability to sustain these efforts. Chairperson, sir, Tanzania continues to support WHO organization prioritizations and the restructuring efforts and the calls for a balanced decisions that suffocate its core missions, especially mind-shifting global dynamics. As I conclude, I wish, on behalf of the government of the United Republic of Tanzania, to reaffirm our commitments to health equity, solidarity, and a stronger global health system. Thank you very much, Skomo Kwambili.
Thank you, Botswana.
Thank you, Chairperson. And let me begin by congratulating Professor Mohamed Yanabi on his appointment as the WHO Regional Director for Africa, as well as for his well-articulated first report to the committee. I would like to wish you a productive tenure of service to the continent. Botswana stands available to help you achieve your objectives, as outlined in your visionary manifesto, which we believe, if implemented as envisioned, will usher in resilient people-centered health systems in Africa. Chairperson, we note the report as presented and the progress made towards universal health coverage across the continent. With the disease burden, health emergencies, and resource constraints in the continent, primary health care remains the cornerstone towards building resilient health systems. Botswana finds itself at a crossroads as our healthcare system has had investments which have not quite matched the healthcare outcomes we have realized. We have amongst this experienced increasing costs to healthcare provision, a reduction in global financing for healthcare, emerging and re-emerging diseases, and new threats brought by climate change, amongst others. In our journey to attain universal health coverage, Botswana has received support from the WHO to develop and cost essential health services package aligned with our national health strategies. This important strategic document is, amongst others, playing a crucial role in the transformation of our health system towards universal health coverage. Chairperson, I wish to applaud the WHO for their continued support to member states on the District Health for All approach, amongst other initiatives. This is an important initiative, especially for Botswana, because we have only recently decentralized our primary health care to local authorities. And we believe that with this strategy, we should be able to allow for more meaningful community participation for primary health care. Chairperson, this time calls for strategies that are innovative and targeted to our peculiar circumstances as a continent. And these strategies should be geared towards systems that are digitalized and which use the latest artificial intelligence diagnostics. I know, Chairperson, in appreciation from the report work done in member states by the WHO in this regard. This time, more than ever, is important to allow for evidence-based decision-making. We thank you and we appreciate and welcome the report. Thank you so much.
Thank you. Burundi. Yes. Will be followed by Uganda in that order.
Merci, Monsieur le Président. Monsieur le Président, Mesdames et Messieurs les ministres, au nom du gouvernement et du peuple du Burundi, je tiens d'abord à remercier le bureau régional de l'OMS pour l'Afrique pour son rapport riche et éclairant, ainsi que pour l'appui constant qu'il apporte à nos pays, en particulier dans ce contexte de contraintes financières de défis sanitaires majeurs. Le Burundi a enregistré des avancées notables dans le renforcement de son système de santé. Nous avons en effet maintenu le statut libre de poliovirus sauvage, introduit le vaccin contre le paludisme, validé l'élimination du trachome et progressé de manière significative dans la lutte contre le VIH-Sida. Ces résultats sont le fruit des efforts du pays soutenus par nos partenaires, en particulier l'OMS. Cependant, notre système de santé demeure confronté à des défis importants, dont un financement intérieur encore limité, une forte dépendance de l'aide extérieure, des ressources humaines insuffisantes inégalement réparties, ainsi qu'une charge persistante des maladies transmissibles et de mortalité maternelle et infantile. Et la résilience du système est également mise à l'épreuve par l'afflux massif des réfugiés et des menaces épidémiques transfrontalières. Conscient de ces défis, le Burundi a engagé des réformes majeures de la finalisation de financement de la santé fondée sur les soins de santé primaires comme le socle de l'activité santé universelle, élaboration d'un plan d'investissement dans les ressources humaines pour améliorer la disponibilité et la fidélisation du personnel qualifié. Monsieur le Président, le Burundi réaffirme son engagement à renforcer son système de santé tout en consolidant la coopération régionale et internationale en matière de santé. Face aux menaces communes qui transcendent les frontières, dont les épidémies, les urgences sanitaires, les résistances aux antimicrobiens, il est impératif de renforcer notre solidarité et de mutualiser nos efforts pour bâtir les systèmes de santé plus résilients. À cet égard, Monsieur le Président, le Burundi salue le rapport du directeur régional et encourage l'ensemble des États membres à en prendre pleinement note, à soutenir sa mise en œuvre et à travailler de concert pour accélérer les progrès vers la couverture sanitaire universelle et la sécurité sanitaire dans notre région. Je vous remercie.
Uganda, as I mentioned.
Thank you so much, Mr. Chairperson. Chairperson, it is of great honor to applaud the regional director for a job well done and the entire team. And I want to take this opportunity to congratulate Professor Muhammad Janad on assuming leadership of our organization, and to you, Mr. Chairperson, and the rest of the team. Uganda is appreciative for its inclusion on different various levels where it is committed to serve. Mr. Chairperson, on the work of that we are gathered here, the time that has immense challenges as have already been elaborated, health systems face dwindling financing difficulties in mobilizing domestic resources. It is our commitment as Uganda that we shall join the rest of the state members to ensure that we also participate as a country to ensure that our budget for the health system sector is increased, and we must, as a country, make health sector our priority as we are doing. Uganda is committed to walking the talk with the rest member states to ensure that we have a sustainable health system for the good well-being of our people. Mr. Chairperson, Uganda welcomes the high-level dialogue on partnership for local production of medicines, vaccines, and health technologies. Investing in regional production is vital to ensure access, self-reliance, and preparedness for the future threats. Mr. Chairperson and the Honorable Excellencies, Uganda reaffirms the importance of emergency preparedness as experience, and the director who has well appreciated the response that Uganda during the time of Ebola and Marburg and Mpox demonstrated the value of strong surveillance. Surveillance, rapid response, and community engagement is the way to go if we are to be prepared to ensure that we have a preparedness system that is strong enough. We are committed as a country to strengthen these systems and sharing lessons with all our neighbors and member states.
Uganda welcomes the region director's report and commits to work with WHO and member states to accelerate UHC, secure sustainable financing, strengthen global health partnership, and to have a very strong private partnership to ensure that our communities will build a resilient system, a health system that serves our people equitably, sustainably, and to leave no one behind. It is our commitment that as a country, we have involved a system that goes down back to the people as we work towards every person not to be left around. I thank you.
Togo, followed by Burkina Faso.
Merci, Monsieur le Président. Monsieur le Président, Monsieur le Directeur régional, le Togo félicite le directeur régional et son équipe pour les efforts déployés ayant permis l'obtention de ces résultats satisfaisants à travers leurs actions importantes dans les États membres malgré de graves crises financières, la gestion d'une charge exceptionnellement importante de situation d'urgence sanitaire, ainsi que 3 transitions majeures au niveau de la direction. Le Togo, une fois encore, salue le leadership visionnaire du Dr Matshidiso Moeti et la gestion de la transition avec clairvoyance et détermination du Dr Chikwe. Monsieur le directeur régional, permettez-moi de vous féliciter pour votre brillante élection au poste de directeur régional de l'OMS pour l'Afrique et réitérer mes vœux de réussite au cours de votre mandat. S'agissant du rapport, le Togo apprécie les résultats obtenus notamment la réponse à plus de 100 situations d'urgence de santé publique, le déploiement des vaccins antipaludiques dans 19 pays, l'appui élargi à la santé mentale dans plus de 20 pays, la vaccination contre la rougeole et la vaccination systématique pour 107 millions d'enfants, le renforcement du financement de la santé dans plus de 80% des pays, la validation de l'élimination de 3 maladies tropicales négligées, l'influence croissante de l'Afrique dans le domaine de la santé mondiale lors des négociations préalables à l'accord sur les pandémies. Tirant les enseignements de ce rapport, le Togo partage et soutient les actions à venir du secrétariat axées sur les priorités stratégiques, entre autres, renforcer les soins de santé primaires et les fonctions essentielles de santé publique pour améliorer la résilience et l'équité des services. Soutenir la mobilisation des ressources et la viabilité financière au niveau national par le biais des stratégies et des réformes nationales d'investissement. Développer les innovations numériques et respectueuses du climat afin d'accélérer l'adaptation dans les contextes de fragilité. Favoriser des partenariats multisectoriels alignés sur les priorités nationales et amplifier l'impact régional. Renforcer les capacités nationales de préparation aux situations d'urgence et de riposte, en particulier dans les situations de conflit et de vulnérabilité climatique. Le Togo prend note du rapport et soutient son adoption. Je vous remercie, Monsieur le Président.
Merci beaucoup. Monsieur le Président, Monsieur le Directeur général, Monsieur le Directeur régional, distingué délégué, permettez-moi avant tout propos de témoigner ma gratitude au gouvernement et au peuple frère de la République de Zambie et de les remercier pour la chaleur typiquement africaine de l'accueil réservé à ma délégation et à moi-même depuis notre arrivée dans cette belle ville de Lusaka. Je voudrais par la suite féliciter le professeur Mohamed Janabi, directeur régional de l'OMS pour l'Afrique, pour la qualité de son rapport qui démontre avec éloquence comment un appui technique ciblé et une collaboration multisectorielle peuvent renforcer la résilience des systèmes de santé, même dans les contextes les plus difficiles. Mesdames et messieurs distingués délégués, sous le leadership de son Excellence le capitaine Ibrahim Traoré, président du Faso, chef de l'État, le Burkina Faso a engagé d'importants efforts pour améliorer significativement son système de santé. C'est en effet 12% du budget de l'État alloué au ministère de la Santé, malgré le contexte sécuritaire et humanitaire marqué par des attaques lâches et barbares de terroristes. Ma délégation salue le partenariat stratégique entre le Burkina Faso et l'OMS, notamment en matière le renforcement de la gouvernance et la prestation des services dans le domaine de la nutrition jusqu'au niveau communautaire, de la lutte contre le paludisme. Le Burkina Faso est passé à l'échelle du pays pour la vaccination contre le paludisme avec le vaccin R21 et la poursuite des autres interventions de lutte contre le paludisme, notamment la chimioprévention du paludisme saisonnier, la lutte vectorielle et j'en passe. Du renforcement de la protection de la population contre les menaces sanitaires avec la formation de 100 experts pour les interventions en cas d'urgence sanitaire, notamment dans le domaine du surge. De la promotion du bien-être tout au long de la vie avec le déploiement du PEN et du WUPEN dans les formations sanitaires et le renforcement des services intégrés de lutte contre les cancers féminins. Aujourd'hui au Burkina Faso, jusque dans les plus petits villages reculés, on peut faire une échomammographie gratuite, on peut se faire dépister pour les lésions précancéreuses du col de l'utérus et cela gratuitement. Ces actions menées dans un environnement opérationnel parfois difficile ont été déterminantes pour améliorer donc l'accès aux services de santé, y compris pour les plus vulnérables. L'expérience du Burkina Faso prouve qu'avec un leadership national déterminé et un partenariat international franc et solide, il est possible de bâtir des systèmes de santé plus résilients. Ma délégation voudrait terminer en réitérant l'engagement du Burkina Faso à renforcer sa coopération avec l'OMS et tous ses partenaires sincères pour construire un système de santé durable et équitable afin de garantir le droit à la santé pour chaque Burkinabé. Je vous remercie.
Thank you. Thank you. Ghana, followed by Malawi.
Thank you, Chair. Ghana, thank you so much for the opportunity to take the floor to comment on Agenda Item 6, Annual Report of the Regional Director on the work of WHO in the African region. I bring warm greetings from the government and the people of Ghana and express our deep appreciation to the WHO Regional Office for Africa for its unwavering support and leadership during a year marked by unprecedented challenges and transformative progress. We commend the Regional Director, Dr. Mohamed Janabi, for his visionary stewardship and for the comprehensive report presented, which reflects the resilience, innovation, and commitment of member states across our region. Ghana is proud to have contributed meaningfully to the regional impact highlighted in the report, notably the successful completion of our first nationwide WHO STEP survey in 2024 stands as a milestone in our public health surveillance effort. The findings featured on page 62 of the Regional Director's Report offer critical insights into the burden of non-communicable diseases and risk factors affecting our population. This data is already informing national policy, guiding resource allocation, and shaping our response to emerging health challenges. We also acknowledge WHO's support in strengthening our health workforce, advancing digital health, and integrating mental health, and non-communicable disease services into primary care. These efforts are aligned with our national priorities and the Lusaka agenda, and we remain committed to deepening reforms that promote equity, sustainability, and innovation. As we look ahead, Ghana reaffirms the commitment to regional solidarity and African-led health transformation. We call for continued investment in primary health care, stronger emergency preparedness, and predictable financing to sustain the gains we have made. Let us move forward together with purpose, partnership, and a shared vision for a healthier, more resilient Africa. Ghana notes the report. Thank you.
Malawi, followed by Central African Republic.
The chairperson, distinguished delegates, the Republic of Malawi commends the World Health Organization Regional Office for Africa for the comprehensive report presented by the Regional Director. We commend WHO's leadership in advancing universal health coverage, health security, and healthier populations. Malawi values the strong collaboration between the Ministry of Health and WHO, which has enabled the country to make significant strides in areas that have been highlighted in the report. We also recognize the achievements that we've done with support from WHO. For example, the establishment of Public Health Emergency Operations Center for disease surveillance, early detection, response, as well as management. Another support has gone to integration of cholera response, where we're combining WASH, vaccination, community engagement. We've also noted polio transition, whereby now we are ensuring continuity of essential immunization services. As we speak now, with support from WHO, we have integrated oral cholera vaccine into routine immunization, making cholera prevention more sustainable in a disaster-prone communities. We've also seen strengthening of laboratory surveillance and digital health platforms, which are improving real-time disease detection as well as service delivery. All these have been achieved with collaboration with WHO, and thanks to their technical as well as financial support. Despite these milestones, we still have challenges as a country. We need to envision on how we need to sustain the integrated cholera prevention, as this would require predictable financing as well as a stronger supply chain system. More support would also be required in the Public Health Emergency Operations Center for it to be fully functional. And we acknowledge the development of dashboards by WHO, but would also want that this system should be led by government for real-time monitoring for all health indicators. We call on the WHO to continue supporting African countries in building their capacity, strengthening the health systems, enhancing partnerships and collaboration, and improving access to quality health care. Malawi is committed to working with WHO, other member states, and other development partners to ensure successful implementation and achievement of our health goals. I thank you for your attention. Zikomo kwambiri.
The Central African Republic, or by South Africa.
La République centrafricaine félicite le directeur régional pour sa brillante élection et apprécie ce rapport très clair, reflétant les efforts fournis par le bureau régional dans la réalisation des activités pour la période allant de juillet 2024 à juin 2025. La République centrafricaine réitère, en réitérant ses félicitations, la République centrafricaine exprime sa confiance au directeur régional dont les premières actions sont déjà prometteuses. Malgré de nombreux défis opérationnels et les contraintes financières qui ont marqué la période du rapport, le bureau régional a su apporter aux États membres les appuis techniques et stratégiques nécessaires. En République centrafricaine, de nombreuses actions sont réalisées grâce à l'appui de l'OMS qui est de plus en plus visible et fort. Parmi celles-ci, une coordination renforcée qui a permis de maintenir des services essentiels en zone de conflit, des appuis aux campagnes de vaccination pour atteindre les enfants zéro dose qui sont de plus en plus dépistés, le déploiement des vaccins antipaludiques, l'appui à la préparation et riposte aux épidémies et surtout le développement des ressources humaines en santé par le développement d'une stratégie nationale de ressources humaines, le développement d'un dossier d'investissement. Nous demeurons néanmoins préoccupés par l'impact des contraintes financières qui risquent de provoquer une pénurie de ressources qualifiées et compromettre l'appui technique et stratégique au pays. La République centrafricaine lance un appel à l'OMS pour renforcer l'appui technique au pays, notamment par des mécanismes souples de mobilisation des experts et une meilleure optimisation des ressources existantes. La République centrafricaine tient particulièrement prie l'OMS d'accorder une attention particulière au fonctionnement de nombreux pays par une gestion non complaisante des ressources humaines et un meilleur accompagnement plus adéquat des représentants de l'OMS pour que ceux-ci servent de façon plus efficace les pays. La République centrafricaine, le professeur Fossé Alkaj Touadéra, président de la République, chef de l'État, vient de déclarer la mortalité maternelle une urgence nationale et compte sur l'OMS pour relever ces défis. L'OMS peut compter sur la République centrafricaine pour renforcer son leadership en matière de santé au niveau pays, au niveau régional et dans le monde. Je vous remercie.
South Africa, followed by Seychelles.
Honorable Chair, Excellencies, distinguished delegates and guests, on behalf of South Africa, I would like to extend our warmest congratulations to the government and the people of Zambia for assuming the chairpersonship of WHO Afro. We also appreciate the hospitality and warm welcome extended to us in Lusaka. We would like to once again congratulate Professor Mohamed Yacoub Janani on his assumption as the new Regional Director of WHO Africa Region. We look forward to working with him and appreciate his leadership in advancing health agenda in our region. We commend the program subcommittee for its comprehensive statement. We align ourselves with the key issues raised and priorities identified, including accelerating progress and the health well-being of women, children, and adolescents by transforming health systems in our region, as well as strengthening Africa security. I would like to acknowledge the achievements highlighted in the WHO Regional Office for Africa's report. Despite financial constraints, WHO supported 47 member states in progressing towards universal health coverage with a focus on primary health care. The district health for all approach was implemented in 17 countries. WHO also responded to 168 public health emergencies and improved emergency preparedness in 36 countries. Additionally, 5 countries validated the elimination of at least one neglected tropical disease, and nutrition efforts were advanced in 28 countries. However, we are concerned that in advancing these plans, there is a paucity of debate regarding how our efforts are going to be financially sustainable. The recent withdrawal of international partners and donors in supporting health system in developing countries, particularly on the African region, create sustainability concerns. The defunding and underfunding of our health systems threaten and undermine any progress that we might have made in strengthening health system and achieving universal health coverage. Chair, we wish to state without any equivocation or any fear of contradiction that while international solidarity is very precious and appreciated, in today's uncertain world, the primary responsibility of taking care of citizens lies with member states and no one else. We urge member states to prioritize health financing and explore innovative financing mechanisms to support our health system as we approach 2030 Sustainable Development Goals. Thank you.
Seychelles, followed by Senegal.
Monsieur le Président, je vous remercie pour la parole. Le rapport annuel du directeur régional mis sous notre examen démontre clairement que l'Organisation mondiale de la santé continue de jouer un rôle crucial en Afrique, où ses efforts ont conduit à des réussites remarquables. Cependant, des défis persistent. Les systèmes de santé fragiles, les difficultés d'accès aux soins dans les zones reculées et les financements insuffisants freinent les progrès. Les crises sanitaires récurrentes, exacerbées par les changements climatiques et l'insécurité, exigent une mobilisation accrue. La situation particulière des petits États insulaires comme les Seychelles appelle à une attention particulière, tant du côté de l'assistance que du côté de l'auto-assistance. Une synergie accrue entre l'expertise technique de l'OMS, l'engagement politique et financier de nos gouvernements, l'innovation et l'engagement accru du secteur privé et la mobilisation des communautés doivent toujours prévaloir. L'autonomisation du continent en matière de santé est la voie à suivre pour garantir la santé pour tous, et avec une volonté de faire, cette autonomisation reste bien entre nos mains. Je vous remercie.
Senegal followed by Congo.
Merci beaucoup, Président. Le Sénégal félicite le directeur régional de l'OMS pour l'Afrique pour la qualité de son rapport.
For Africa, for the quality of his report. We would like to add our congratulations to his predecessor, Dr. Mweti and Dr. Chikwe, because they have ensured the continuity of our work during this transitional phase. Senegal completely appreciates all the work that WHO has done at the country level and with our governments to ensure that our region will have sustainable health achievements despite financial constraints. We are adhering to IDSR 3, and we would like to thank the WHO for their support along this process. The achievement we have made here will ensure us that we will have better access to medicines and to vaccines in line with the visions of the President of the Republic regarding the pharmaceutical area. In terms of public health emergencies, we appreciate the medical assistance teams that were provided by WHO, and we would like to renew our commitments so that we can contribute to health security in our region. More recently, we would recognize the critical help that the WHO continue to provide in terms of elimination of NTDs, including LF and so on. In terms of governance, WHO also has been supporting Senegal to support their systems in line with their transformation agenda for the last 5 years. In conclusion, Senegal would like to wish the regional director a fruitful mandate together with his team so that together we can build better health in Africa. Thank you for your kind attention.
Congo,
Monsieur le Président,
Congo, once again, would like to congratulate Dr. Janabi, the Regional Director of WHO for Africa. We welcome him as the head of our organization. We would also like to congratulate his team. With regard to combating epidemics and mpox and cholera, Congo recognizes that all the technical and financial support provided by WHO, particularly in the training of epidemiological surveillance officers and field officers, as well as other personnel that are crucial to combating these outbreaks. In addition to these outbreaks, WHO has supported national programs in the area of mental health and in coming up with national policies for health promotion in general. In terms of GPW 30 of WHO, Congo is operationalizing it's the 3 billion targets over the 52 and we are wanting to ensure that we cover 13% of the population. The Republic of the Congo would like to support the implementation of the 13th General Program of Work, which is building on the continuity of efforts by WHO in the past to protect and safeguard the health of the people, whilst at the same time supporting the SDGs and also improving their own performance. Thank you.
Eswatini, followed by Zambia.
Thank you, Honorable Chair, for the opportunity. Warm royal greetings from the Kingdom of Eswatini. Eswatini would like to congratulate the new Regional Director on taking up his role. Although I could not make it to vote during the nominations, I am reliably informed that Eswatini voted wisely. We appreciate the comprehensive report for July 2024 to June 2025 presented by the Regional Director. The report highlights the major successes made and the challenges faced by WHO in advancing health in the Africa region. Among the top 10 achievements are strengthening of health financing in over 80% of countries, delivering measles immunization to 107 million children, and data systems improvement in 42 countries. These achievements are commendable, and WHO support to member states is not going unnoticed. In Eswatini, we have benefited from the support from WHO in the development of the health financing strategy in the past month, which is being finalized. The process included building capacity of the Health Financing Technical Working Group to continue monitoring the implementation of the strategy. This strategy is aimed at introducing financing reforms in our health sector, ensuring a shift from using tax-based financing for health to introducing prepayment and pooling of funds through a national health insurance. Additionally, we have also partnered with WHO during the month of August to carry out a successful measles rubella immunization campaign, where 81% of the eligible children were covered. Through this campaign, children who had missed immunization due to various reasons were able to access it and therefore protected from preventable childhood diseases. While we celebrate the successes, Eswatini is alive to the challenges posed by the dwindling financial envelope and the recent sudden halt of funding from the US government. This was unprecedented, but it was a reminder of the importance of each member state in Africa achieving self-reliance and managing public health threats. As a region, I urge all of us to come together in solidarity, share experience and resources to build a resilient health system in Africa. Yabo, thank you.
Zambia followed with DRC.
First, congratulations to my minister on his election as chairperson. Zambia appreciates and endorses the rich report by the World Health Organization. Zambia also appreciates past and ongoing technical support from the World Health Organization. We concur with you that for us to achieve universal health coverage, we need the following: human resources. Zambia has recruited 21,000 healthcare workers in the last 3 years. Drugs. Zambia has increased the availability of essential drugs in the last 3 years from 43% to over 85%. Infrastructure. We continue to increase infrastructure for universal health coverage. Health finance. We are at 12% of the Abuja Declaration. If we take into account other streams of funding, we are almost at 15%. Emergency preparedness. Zambia argues a holistic approach through a hierarchy of controls. We need to anticipate threats. We need to prevent these threats. We need to mitigate, We need to stop them, and we also need total eradication. Now, for us to do this, we need to develop tools, and let us develop these tools together as Africa. Some of the tools that we need to develop include research, surveillance systems, immunizations, treatments, and above all, dealing with the determinants of the threats. I argue that, or Zambia argues that, we leverage each other's capabilities. That's the only way we are going to succeed. I thank you, Mr. Chairman.
DRC followed with Namibia.
Merci, Monsieur le Président.
Thank you, Chair. Regional Director of WHO for Africa, Excellencies, ladies and gentlemen, I am taking the floor on behalf of the DRC, representing the Ministry of the Minister who is unable to attend. Like my predecessors, I would like to congratulate the Regional Director and the chair, as well as the other office bearers. I would like to commend the regional director for the quality of his annual report for the WHO African region. I would like to remind you of the context behind the outbreaks that we have seen in Congo in terms of both Ebola and Mpox. Since 1990, we have our heads of state have been supporting the march towards achieving UHC. The heads of state on the 17th of September 2023 drew up a vast program looking at maternal and newborn health with the aim of achieving UHC. We have 14 out of 17 districts in Kinshasa that are being covered. We do have the countries, or rather the provinces that are benefiting that have meant that we have had skilled attendance, and since September 2023, we have really recorded enormous progress. Since the start of this year, the government decided to extend the program of health to the military, and also because they are defending the integrity, our national integrity, in spite of the wars that are unjustly being waged against us in the east of the country. The government is not sparing any efforts to really focus on primary health care, focusing on reaching UHC. I can highlight new innovative financing mechanisms, particularly at the domestic level. And here we are focusing on trying to focus on external aid as well. In this context, we hope that we can really move forward in terms of achieving everything through one health for all. Thank you.
Namibia followed by Mozambique.
Thank you so much, Chairperson, and congratulations for your election as chair of this August committee, the WHO Afro Committee. And as we take the floor for the first time, let me also register my delegation's appreciation for the hospitality that is placed and extended to us and to all delegations. As you know, Chair, Namibia is coming to Zambia, and in particular to Lusaka, is a perfect coincidence because it is another homecoming for Namibia, and we look forward to visiting the familiar sites in the beautiful city of Lusaka. So right at the onset, Chair, then allow me to also join other delegations that have spoken to sincerely commend the regional director for his team for the comprehensive report on the work of the organization, to commend the director for the visionary leadership and the unwavering commitment to advancing the Africa Health Agenda upon resuming office not too long ago. Chair, this report provides a comprehensive countdown of actions undertaken during the reporting period, which serves as a mirror image of the actions taken at the member state level or actions that must be taken at member states level. So as such, Chair, Namibia acknowledges the tangible progress made towards universal health coverage, which is a cornerstone of our national health framework and sustainable development goals. Namibia adopted the universal health coverage policy last year, and we are at this point in time busy with finalizing the draft universal health care bill, which we intend to finalize this year. We appreciate the technical input that WHO provides, and we look forward to the peer learning and experiences from the member states seated around this table that have gone through this milestone. We have also strengthened our supply chain system to reduce pharmaceutical stockouts through pool procurement as advanced, through bulk procurement at source, which has enhanced our ability to have visibility through the systems and to ensure sustainability of supplies. We are investing in the health information systems in order to improve decision making. We are incorporating oral health care into our national response mechanisms for non-communicable diseases. We are looking at our readiness and the prevention mechanisms for the emergencies, and we are looking at health spending, which stands at about 13.7%, just shy of the Abuja Declaration, and it's our commitment to move towards that target. Thank you so much, Chair. We commend and we appreciate the report. Thank you.
Mozambique, followed by Sierra Leone.
Muito obrigado, Senhor Presidente.
Thank you very much, Mr. President. It is with great honor and humility that I would like to commend and congratulate the RD for its excellent report. In spite of our financial constraints, we have made huge efforts in saving lives. Mozambique is working on the strategies and priority pillars of our region so that we can have sustainable health financing systems. Mozambique would like to commend the role of the WHO as a very reliable, dependable technical partner. This really helps to strengthen our countries, helps us to build resilient health systems which are equitable for all. I would also like to commend WHO's help to Mozambique in terms of vaccinations to control measles, the vaccination against HPV and malaria, as well as our candidature to reach level 3 of the locally acquired drugs, and also to attract better funding for our country. Mozambique would like to reaffirm its commitment to work very closely with WHO and with all its other regional partners so that these lessons and learned and progress can be consolidated in the future. Together, we will build better health in Africa and make sure that nobody is left behind due to lack of food or health services. Let us work together. Thank you very much.
Iran, followed by Nigeria.
Thank you very much, Mr. Chair, and congratulations on your appointment. I also want to take this opportunity to congratulate Professor Janabi for his role, and clearly from your first report, very thoughtful report. We appreciate and align ourselves with the vision seen in that report. I'd like to share with you in the few minutes I have Sierra Leone's position on our relationship with WHO. We have expressed health sovereignty over the past few years, past 6-7 years, where we are asked to rethink or reimagine healthcare delivery. We allocate about 11.7% of our budget on health. And what we wanted to do was, instead of going through these siloed disease-based interventions, that we want to look at the person. And we're looking at the life stages approach at healthcare delivery from pregnant women, looking at all of the health care that a pregnant woman deserves, all 350 to 450,000 of them a year,
all the way till the baby is born, until this baby is ready for school, until school help and adolescent, until they are adults and they're senior citizens. And we look at the healthcare delivery across the board using the life stages. We also embrace universal health coverage, and what we want to do, what we've been doing over the past, is to see how do you embed these services, focusing on the individual, the patient-centered care and client-centered care. We've registered some very impressive results. We reduced maternal mortality by over 76%. We reduced infant mortality by over 30%. Our vaccination rates have sustained about 95% consistently over the past 5 years. We've introduced new vaccines, including Ebola vaccine, Marburg vaccine, HPV vaccine, COVID vaccine, and now Mpox vaccine. So we had a system that was going that we're very, very proud of. In January of this year, there was a disruption. We reported the first 2 cases of Mpox. And for us, what we've done over the years is look at prevention, preparedness, and response. But knowing that if there's an outbreak, you really want to consolidate your gains and not lose the gains at all as you respond to the outbreak. Working very closely with WHO and other partners, we saw that the approach that we used was the conventional wisdom of treating people and sending back into the community so that they could take care of themselves. That did not work. For the first few months, we had a major increase in the number of cases from 2 cases to about 5,000. We changed our strategy by identifying people and bringing them into facilities, managing them, whilst we ensure that people that are in that ring, the circle where they came from, that we have effective prevention and control measures. The results are fantastic. They've come down. We're seeing major results. I want to thank WHO for the partnership. I want to thank DRC in particular for giving us 75,000 doses of these precious vaccines to help us contain our situation. Thank you.
Nigeria, followed by South Sudan.
Thank you, Chair, and congratulations on your election as Chair of the RC75. Nigeria also wants to congratulate Professor Janabi on his assumption of office and for delivering a comprehensive report. We are glad to note that the momentum that the Afro region has gained over time is being sustained from what we've seen, and Nigeria is a strong partner for the Afro region, even under your tenure as our regional director. Nigeria is currently implementing health sector renewal investment initiative, which largely aligns with most of the content of the report has been shared by the regional director. And this has 4 pillars for us to improve effective governance of our health system, to improve population health outcome and provide quality health services to our people, to improve on health security, and lastly, to unlock the healthcare value chain. We've identified 3 enablers to achieve this: data and digitization, culture and talent management, and of course, financing. We're using the sector-wide approach, the SWAP, which advocates for 1 plan, 1 budget, 1 report, 1 conversation, and of course, 1 voice. We've employed the instrument of the joint annual review with our national subnationals to annually review what is being achieved in the health sector. So far, we are appreciative of WHO's support for our HRH program, and currently health labor market analysis training is going on in my country. We've introduced the human papilloma virus vaccination with vaccination of over 13 million girls. We continue to intensify efforts with our neighboring countries in the Lake Chad region to combat the emerging vaccine-derived poliovirus variants, and we continue to strive to the elimination of 0 dose in our country with improving security in the areas that are hitherto affected by insurgency in my country. Nigeria continues to champion domestic innovative financing opportunities for health system, and recently we launched the MediPool, which has been identified as a game changer for us to make healthcare affordable in my country. Nigeria affirms our commitment to regional integration to improving continental health security with WHO. Thank you, Mr. Chairman.
Thank you, South Sudan, followed by Mauritius.
Thank you, Mr. Chair, and congratulations on your appointment. Honorable Ministers, the DG of WHO, Dr. Tedros, WHO Regional Director, Professor Mohammed Janabi, congratulations to you and your team. Distinguished guests, ladies and gentlemen, on behalf of the government and the people of South Sudan, I bring warm greetings to this 75th session of the Regional Committee for Africa. I thank WHO and partners for their steadfast support as we strive to advance health and well-being for our people. South Sudan is a growing nation facing challenges of fragility, limited resources, and recurrent emergencies. Yet we remain firmly committed to universal health coverage, protecting our people from health emergencies, and improving overall health outcomes. We have made some progress on universal health coverage, implementing the basic package of health and nutrition services nationwide, prioritizing women and children and adolescents, and investing in health workforce governance, supply chains, and innovations to strengthen health services delivery and ensure equity. On maternal and child health, South Sudan has reduced maternal and child health by over 50% in the past decade through coordinated efforts. However, this progress is fragile, threatening by declining funding and humanitarian fatigue. We urgently call for targeted investments in services and high-burden regions to sustain gains and achieve the 2030 SDGs. On health emergencies, strengthening systems to respond to cholera, measles, hepatitis, and other outbreaks through the Public Health Emergency Operations Centers and integrated disease surveillance system. On community health, through our Buma Health Initiative, we have expanded access to health promotion, disease prevention, and addressing malnutrition, clean water, and hygiene. Excellencies, South Sudan is committed to working with all member states, WHO, and partners to transform health system and build a healthier, more resilient Africa. Together, we can make the Africa we want in reality. Thank you.
Thank you, Mauritius. South Sudan, Mauritius, followed by Algeria. Mauritius. Okay. You have the floor. Mauritius, you have the floor. No. Mauritania. Algeria.
Followed by Mauritania.
Followed by Mauritania. Mauritius is out there. So,
thank you, Mr. Chair. I'd like to thank the Regional Director for the presentation of his report and wish him success in his mission. The whole Regional Director for Africa, Honorable Ministers and the Chair, the Vice Chairs, Honorable Ministers and Heads of Delegation. First, I would like to underscore that health has always been, since 1962, a fundamental public service that has received all attention from the state in terms of building of infrastructure, of funding and capacity building. As an example, we have a life expectancy of 80 years and the infant mortality rate is 17 per 1,000 deaths. As regards universal health coverage, my country has always devoted universal access to health coverage. Access to health is free of charge, and reimbursement of medicines 80%, and drugs are free for needy people and those suffering from chronic diseases. This is made possible through the financial resources that are available and thanks to local production of medicines that has covered 70% of national health emergency. Since the advent of the COVID-19 pandemic, the focus on health risks increased substantially. In this slide, the Health Security National Agency was developed, and it's an early warning system and surveillance system for the epidemiological system of the country. Algeria is about 2.3 million square kilometers, is also close to Europe and borders on sub-Saharan African countries. Hence, the increase of these health risks. Moreover, child vaccination rate 100%, and this was made possible thanks to the density of health infrastructure that is fairly distributed on the national territory. As regards strategic priority 3 and 4, several measures that are preventive and cross-cutting have been taken, including road security, food security, through grants to essential food services and the taxation of tobacco. Concerning the last strategic action, our country strengthens health research, like the Institute Pasteur, and also strengthens cooperation with other African countries to improve access to basic health through the scholarship program and scholarship to students.
Merci, Monsieur le Président.
Thank you, Chair. First, I would like to express my profound gratitude to the Republic of Zambia for the warm welcome. We're really touched by the quality of the organization and the hospitality that was reserved for us. I'd like to express my heartfelt congratulations to Dr. Janabi for his recent election as Regional Director for Africa. It is it's a heavy responsibility, and I'm convinced that he will be up to the task. And Mauritania would like to reassure him his support in the discharge of his new responsibilities. I'd like to congratulate the concrete actions that he has already been taken under his leadership, which attest to his resolve for constructive dynamics in the region. His report that he presented attests to these resolve to act despite the persistent challenges backed by scarce financial resources. This shows committed leadership and capacity to adapt that I'd like to congratulate, I'd like to recognize. The things that featured in his report will to focus the report on what counts most for our citizens to health prevention and the strengthening of health systems. In this slide, I'd like to thank the Secretariat on the quality of a 2024-2025 report presented by the director, whose clarity highlights the real impact of actions undertaken and then illustrated by the statistics and the achievements that were presented to us. Mr. Chair, I can't end without lauding and thanking the former director of the WHO for his efforts and his remarkable accomplishment. He's a wise and very talented person. Thank you very much.
Followed by Guinea-Bissau.
Muito obrigado, Sr. Presidente. Gostava, em primeiro lugar, de
Thank you. Firstly, I would like to congratulate once again Professor Mohamed Janabi for his outstanding victory in the elections. And I would also like to recognize the presence of the Director General at our meeting. I would also like to greet the people and the government of Zambia and thank you for your warm welcome. Cabo Verde agrees with all the challenges that were highlighted by Professor Janabi. These are cross-cutting issues. They affect all of our African countries, and together we will be able to achieve an Africa which is free of diseases, and we can provide and offer a better future and health for our people, so that they are no longer considered the poor cousins on the global arena. Cabo Verde, although it is a small country, and in spite of the poverty which characterizes this country, is very proud of the achievements that it has achieved. Huge achievements in terms of service delivery, achievements in terms of policies which are very people-centered, based on men, women, and children in Cape Verde, because they are the greatest rich and assets that we have. And as we have focused our efforts on the human aspect, on women and children in particular, we have been working in terms of maternal and infant mortality rates. Our maternal mortality rates has also improved, and especially in terms of skilled attendance. And we also have improved our life expectancy rates both for men and women. And this is because the government of Cabo Verde has focused on the human aspect. It is very people-centered, orientated. We know that the future lies in strengthening our health personnel and in improving our health, our financing situation. Anyway, we are here to work together. Thank you.
Guinea-Bissau, followed by Ethiopia.
Obrigado, Sr. Presidente.
Thank you, Chair.
Permita-me, antes de mais,
First and foremost, like my predecessors, I would like to sincerely congratulate the regional director, Professor Janabi, for the excellent presentation of the annual report, the work of the WHO in the African region. This has highlighted not only the success stories at country level, but as well as the persistent challenges that we are all facing trying to improve public health in Africa. Guinea-Bissau, through its presidents and its prime minister, are very strongly committed to the objectives that we all embrace, and we are committed to reducing maternity rates, and we are focusing on strengthening our surgical procedures. We would also like to improve gynecological services. They need to be more efficient and much more accessible and affordable. We have made progresses in terms of rehabilitating the blood banks, and this has reduced the mortality levels in our hospitals because this is important for ensuring quality health for women and children. We are also working with the community sector. This is crucial for us to work well with our patients so that we have dignified conditions for them and also that we have good equipment so that we can promote health-seeking behavior and healthy lifestyle. We are also improving epidemiological surveillance, particularly at the entry points of our countries, so that we can have a rapid and efficient response in the event of any challenges or threats to public health. Regional Director, first and foremost, I would like to reiterate our commitment to continue to collaborate and cooperate very closely with the WHO and our other partners so that we can strengthen our health systems and achieve the sustainable development goals, particularly with regard to achieving UHC universal health coverage. Chair, finally, I would like to address Dr. Janabi and say that Guinea-Bissau and its people are very hopeful of counting on you for your leadership, and we would like to warmly invite you to visit our country and support our people. Thank you.
Thank you, Sophia, followed by Tommy plus Andy, please speak.
Thank you. Thank you, Excellency, and congratulations on your election. And we are very grateful for the hospitality of the government of Zambia and the remarks which were very much impressing in the morning by His Excellency the President. On behalf of the government of Ethiopia, we wish to extend our appreciation to the Regional Director for his comprehensive report, and he addressed both the resiliency of our regions despite the magnitude of the challenge we continue to face. Also, on the behalf of Her Excellency Dr. Magdas, I pass gratitude to His Excellency Professor Janebi for his visit to Addis and have a plantation in Ethiopian Green Legacy Initiative in Addis Ababa recently. The regional committee is special for us, especially after the pandemic agreement made and the decision by the member states to increase access contribution was vital milestones for enhanced health security and achieving universal health coverage. This achievement reflects our shared resolve and the collective strength. Africa must continue to speak with one voice to ensure the successful conclusion of the PAPS annex, which we support strongly. Ethiopia has expanded access to public health care and the integrated service, strengthened surveillance systems, and improved maternal and child outcomes. We are also working on increased investment for PHC, using the Health Impact Investment Platform as an example for coordination action, which we work with WHO. On health workforce development, Ethiopia has benefited from WHO guidance in revising national workforce strategies, addressing shortage, and improving retention in underserved areas. Ethiopia successfully hosted the UN Food Summit and the Stocktake last month, and that highlighted the huge opportunity for transforming food systems and facilitating the commitment in the nutrition agenda in Africa for Africa. The government has committed to enhance emergency preparedness in the response, including mobilization of resources and have effective outbreak control. Our focus also continues to addressing NCDs, mental health, neglected tropical disease, and antimicrobial resistance and the strengthening quality of service delivery. We call for enhanced support from WHO and the partners to strengthen national capacities in evidence and the science and enhance the uptake and the impact of norms and the standards which was passed in our last WHA. Ethiopia supports the forward-looking approach focused on GPW14 and Lusaka agenda, which we all cherish, and other African regional frameworks. We will continue to invest innovation in the domestic financing. Thank you so much, Your Excellency.
Thank you, Sotome and Príncipe, brought by Madagascar.
Thank you very much, Chair. Regional Director of WHO, dear ministers. WHO in Africa has had a lot of experience and huge challenges in terms of all that has gone on so that they can improve the health of their populations. Fortunately, the member states have been working together and have come up with mechanisms for actions which have really brought together all our work and our challenges together. We have health professionals in our offices, and in spite of the financial cutbacks, our personnel are very dynamic and very proactive in their responsibilities. We have had many initiatives which are huge success stories, and some have been stated by the regional director, and this has really outlined how we have a future, a bright future, especially if we can consolidate on our gains. Universal health coverage is an important, crucial goal, and we should not lose our way in trying to follow through with it. To this end, we need to work on the quality aspect. Notwithstanding our achievements, we do have vulnerable populations, and exacerbating the situation, we have a rise in NCDs, we have climate change. These are also threatening mental health and other issues. This increases the threat of new threats, of new challenges in the futures. Therefore, we need to work together to come up with local solutions. We are making promises to our young people, but this depends on training, continuous training of young people and health personnel. By way of example, if we work on South-South cooperation, last year we had a group of Angolan nurses who came to São Tomé and Príncipe. Now we are hoping to receive some specialists from Mozambique. Several technical experts from different African countries have come to support our health sector and our health systems. Therefore, we would like to thank all our African brothers and sisters in São Tomé and Príncipe. We have an ongoing reform process in terms of the financing structures so that we continue to improving our health indicators. We have huge challenges, but nevertheless, we think that we can be vibrant and we can consolidate good governance and sustainable peace in Africa. Thank you.
Followed by Liberia.
Thank you very much, Chair. First, we would like to congratulate the Regional Director for the progress presented in the report made earlier, reaffirming the successes of the African region despite the challenges that we are facing up to. Yet we are making efforts we encourage him to continue this life. Since Madagascar has benefited from support that has made it polio-free, recognizes the unwavering support of partners, especially the WHO. This support enabled us to institutionalize the Public Health Emergency Center and to implement the One Health approach, and in preparing and detecting and response to public health emergency. We undertake to continue promoting universal healthcare in order to meet the needs of the community in strengthening primary healthcare. We also continue efforts in eliminating filariasis in the country in collaboration with the WHO. The introduction of the vaccine against cancer, which is ongoing or underway, will be implemented in October this year, is a major progress for Madagascar to reduce the death of. Would like to laud the support of our partners, WHO and Medicine Alliance. We'll reiterate our commitment to maintain collaboration to improve the health of the Madagascar people and that of the African region. Thank you very much.
Liberia followed by Niger.
Chairperson, Regional Director, distinguished delegates, permit me to congratulate you, Chair, on your ascendancy to the chairperson of the 75th session of the Regional Committee of Africa. On behalf of the government and the people of Liberia, I thank the Regional Director for his insightful and forward-looking report. We acknowledge the quality of the report. We commend WHO for its continued leadership in advancing universal health coverage, strengthening primary health care, and building resilient health systems in Africa. Liberia aligns with these priorities and has made significant strides in community health delivery, disease surveillance, and health system recovery. We additionally wish to commend WHO for their swift response in providing support to our ongoing mpox response. Liberia remains committed to the Regional Committee's goals and stands ready to work in solidarity with all member states to improve the health and well-being of our population. Thank you, Mr. Chair.
Thank you, Niger, followed by Chad.
Merci, Monsieur le Président.
Thank you, Mr. Chair.
Mesdames, Messieurs les ministres.
Honorable Ministers, distinguished delegates, I would like to first of all congratulate you, Mr. Chair, for your brilliant election at the helm of our work as well as the other officers. I also like to congratulate the new regional director and his team for your brilliant election, which characterizes a very challenging financial context. The excellent report that you presented to us gives us great hope for a WHO that is more strengthened to face up the current or the burning challenges. The Niger and recognize this report with the work in my country is supported by WHO and other partners. Among these achievements, we can mention the certification of the eradication of onchocerciasis, the introduction of the vaccine against malaria, response to other epidemics, meningitis, polio, yellow fever, and very soon diphtheria. I'd like to reassure you that the highest authorities of my country have taken commitments to improve access to health and quality services for the Nigerian population. By way of example, let's mention the reduction of by 50% of health expenditure in the public sector, strengthening of reference health units, and the development of specialties in order to reduce external evacuation that eats up the budget of the state, namely cancer, and it applies to all the efforts to reduce maternal death, which is now a public health emergency. To conclude, Niger approves the excellent report presented and will work to ensure the implementation of the recommendations with the support of the WHO. Thank you very much for your attention.
Followed by Lesotho.
Monsieur le Président, Honorable Chair, Honorable Ministers, distinguished delegates, Chad is honored by its participation in these proceedings. I would like to thank the Zambian authorities for the warm welcome that is reserved for this delegation. Chad, through me, would like to congratulate the members of this session for their election. Chad would like to congratulate the regional director for his election and for his first report that is very comprehensive and filled full of challenges. Mr. President, Chad recognizes this report or identifies with this report because the challenges presented in it are those faced by Chad, and Chad would like to collaborate with the African Union to address these challenges, including the strengthening of the sovereignty for Africa in production in a harmonized and complementary manner. It's in this light that Chad, based on the guidelines of the President of the Republic, collaborates with the various bodies of African bodies to operate the African Medicines Agency. Mr. Chair, Chad would like to thank the WHO and other partners for their support in this light to face up to the various challenges related to the external shocks that it's been facing over the past few years. That's, for example, the humanitarian crisis. I like to mention the humanitarian crisis due to massive influx of refugees fleeing the war in Sudan. Their management was a huge challenge for Chad, whose health system is already fragile. It is a health crisis that is underfunded, and in addition, this crisis has led to another critical situation. Cases of cholera, outbreaks of cases of cholera. 1 month ago in the east of Chad. I'm appealing for your support to enable Chad to quickly put an end to this outbreak, which is a crisis, another crisis, and it's a real and major threat, Mr. Chair. That takes due note of the report presented by the regional director, encourages the other countries to do the same and reaffirm its availability to make its contribution for the strengthening of the sovereignty of health in the continent, which is a challenge that can be addressed. Thank you very much, Mr. Chair.
Thank you. Lesotho, followed by Mali.
Chairperson, honorable ministers, regional director, distinguished delegates, on behalf of the government and the people of the Kingdom of Lesotho, allow me to express our profound gratitude to the World Health Organization under the leadership of our regional director for the comprehensive report presented to this August session. The report provides a clear reflection of the progress, challenges, and opportunities that define our collective journey towards better health for all in the African region. Lesotho commends the region's achievements over the past year in strengthening the pandemic preparedness and response. The lessons of the COVID-19 remain fresh, and we are encouraged by the resilience shown through strong surveillance systems, improved laboratory networks, and renewed commitment to emergency preparedness. This direction resonates deeply with our own efforts as we continue to strengthen our national health security capacities. We welcome the report's emphasis on the universal health coverage and strive to make health systems more resilient, inclusive, and sustainable. For Lesotho, advancing universal health care is not just a policy aspiration, but a moral obligation to ensure that even the most remote communities in our mountains can access essential health services without financial hardship. Regional directors call for stronger cooperation in tackling communicable and non-communicable
diseases, blood safety, rehabilitation services, oral health, and maternal and child health resonates with us. Lesotho also stands ready to contribute to the collective African position on the pandemic accord and international health regulations, ensuring that Africa's voice is strong and unified in global health governance. Excellencies, Lesotho is determined to work hand in hand with fellow member states, WHO, and our partners in shaping a future where every African has access to quality, safe, and affordable health care. Together, we can build systems that are not only resilient to shocks, but also responsive to needs of our people. Finally, we thank the government and the people of Zambia for hosting this 75th Regional Committee session with such warmth and efficiency. Lesotho looks forward with optimism to implementation of the resolutions we shall adopt here, confident that we will accelerate progress towards healthier, stronger, and more resilient societies across our continent. I thank you.
Mali, followed by Gambia.
Merci, Monsieur le Président.
Thank you, Chair. Chair, distinguished guests, I'm taking the floor on behalf of the Minister of Health and Social Development, who should have been the Vice Chair of this meeting. Mali would like to congratulate the Regional Director on his election. My country has been supported by WHO in terms of seasonal chemoprevention of malaria, the introduction of the rollout of the malaria vaccine, and in addition, it has been supported in coming up with a master plan for combating NTDs, neglected tropical diseases. However, continue to ask WHO to kindly help us with training our health workers support. Recently, my country has improved access to quality health services by improving our infrastructures, particularly at second and third reference levels. In addition, access to healthcare is a challenge. In order to bridge this challenge, we do ask for support from WHO. They have always worked alongside us to overcome our challenges. And finally, I think that we should adopt this report because it will help us to move forward with a lot of our agendas in the health arena. Thank you.
Gambia, followed by Guinea.
Thank you very much, Mr. Chair. The Gambia aligns with the report by the Regional Director and once again congratulates him for his election. We add our voice to his in thanking his predecessor, Dr. Moeti, and also the acting Regional Director, Dr. Chikwe. We thank all the hardworking staff of the Secretariat, some of whom have retired now. The progress made by WHO is known to all. There has been a lot of hard work over the past year, and we encourage them to do so in dealing with epidemics, recurrent outbreaks, and then also ensuring that the member countries get the technical and material support that is needed. This is highly welcome. In the Gambia, we are strengthening our health system by ensuring that we improve on access, construction of new health facilities, renovation of old dilapidated ones, provision of life-saving equipment, and capacity building. We've commenced residency training in various aspects of medicine to ensure that there is sustainability. Currently, we have over 100 resident doctors who are undergoing training in various disciplines. Maternal mortality reduction is very high on the agenda of our President, His Excellency President Barrow, ensuring that no woman dies during childbirth. However, the challenges persist: access, road networks, and so on. In the Gambia, His Excellency embarked on a very promising strategy, that is the provision of community ambulances. Recently, over 80 community ambulances have been procured to pick the very sick, especially the pregnant women, from their homes to health facilities. Already, we have seen a remarkable reduction in maternal mortality because of these community ambulances. And this is something we encourage all African countries to do. It is certainly better to buy ambulances than multiple 4x4s for officials. Patients prefer ambulances. So I think this is one thing that we encourage all to do. We are embarking on primary healthcare revitalization. Very soon we'll be launching the expansion and revitalization of the primary healthcare services to ensure that each village in the Gambia is a primary healthcare key village. Mr. Chair, certainly a lot is being done on the African continent, but there is still a lot of health tourism outside Africa. And we believe there is room for African countries to collaborate. We urge the WHO to map out the advantages in various aspects of medicine, various aspects of clinical services, various aspects of preventive services across the length and breadth of the country to ensure that Africans are able to get treatment here. So finally, we encourage the regional director and his to establish regional centers of excellence so that we have South-South collaboration amongst African countries. Thank you very much.
Merci, Monsieur le Président.
Thank you, Chair. Thank you once again. Chair, dear delegates, distinguished guests. Firstly, I would like to congratulate the government of Zambia, as well as the Ministry of Health, for the wonderful, warm welcome we have received ever since arriving in Zambia. We were very tired, but we slept so well. I would also like to take this opportunity to thank the regional director. We slept exceptionally well. We'd like to congratulate the regional director for his excellent work and for the excellent report that he has reported. We would like to congratulate WHO for promoting universal health coverage. And I'd like to inform you that Equatorial Guinea is currently carrying out studies to have universal health insurance schemes. And this is with the help of WHO experts who have already arrived in Malabo, and they have visited us twice before. We would also like to thank and congratulate WHO for the technical support provided to us outbreak, which came in a rural area last year. In addition, we would like to thank WHO for their involvement in the activities to strengthen our health systems, with focus on primary health care, and also for the support in the last measles campaigns after an outbreak in some districts in our countries. The government of Equatorial Guinea is making efforts to combat malaria, tuberculosis, as well as maternal and infant health. And to this end, we are counting on the technical support of WHO. The government of Equatorial Guinea is strengthening capacities and improving human resources, because this is a huge obstacle. We don't have enough specialists in all areas across the board. So we are working on training more specialists in public health, and we would like to call on WHO to support us, as well as CDC. Thank you so much.
Thank you. Thank you, colleagues. I do not see any other requests for the floor from member states. I now invite the representatives of the member states from other regions, UN agencies, and other IGOs to raise their nameplates and remind you that you have 2 minutes. Can't see any nameplate. Can't see anything. Thank you. I understand that a non-state actor has requested to deliver a statement on this agenda item. They are now invited to do so. Remember that you have a minute. Movendi International, you have the floor.
Movendi International commends the Regional Director for an impressive and forward-looking report and welcome the explicit recognition of alcohol policy under the SAFER initiative. We applaud the 15 countries that have taken steps to reduce alcohol harm and WHO AFRO's support. Alcohol is a major obstacle for development in African countries and a major risk factor for cancer, violence, mental health, and communicable diseases. Evidence shows that alcohol harm disproportionately affects young people, women, and the poorest communities in Africa, undermining health, equity, and sustainable development. We therefore encourage countries to accelerate alcohol policy action and call on regional office to deepen support for evidence-based alcohol policy solutions, especially the SAFER policy blueprint, and in particular raising alcohol excise taxes. Scaling up alcohol policy is a high-impact opportunity to accelerate progress on NCDs, mental health, and the SDGs while generating domestic revenue. Movendi International members. Thank you.
Thank you. I see no further requests from the floor. I'll now give the floor to Professor Junabi for his comments. Professor, you have the floor.
Thank you, Mr. Chair. Honorable Ministers, Head of Delegations, colleagues and partners. Thank you very much for all the comments. We have taken them, we'll analyze them, and work on them. I'm a strong believer that any challenge has got a solution. So thank you for your inputs, and we'll work on them. Back to you, Mr. Chair. Thank you.
Thank you, Dr. Janabi. We have completed the discussion of the report, and bearing in mind all comments and suggestions made, can we now consider that the committee is ready to take note of the report of the Regional Director? An objection? An objection? I see no objection. The report is noted. Just as a reminder, distinguished delegates, we are kind of reminding you that there will be no health break between meetings, but we invite you to take a break at your convenience, get tea, coffee, snack, or walk around to stretch yourself. Thank you. Thank you. This brings us to the end of the discussion of this agenda item. Ladies and gentlemen, we shall now proceed with an agenda item under Pillar 1. This is agenda item 7, Regional Framework for Accelerating Implementation of Global Oral Health Action Plan, addressing oral diseases as part of non-communicable diseases towards universal health coverage and health for all by 2030, which contained in the document AFR/RC 75/4. I invite Dr. Benito Imponma, Director and Interim of the Health Promotions, Disease Prevention and Control Cluster, to present the document. Over to you, Doctor. You have 5 minutes.
Mark, can you project the slides, please? Thank you very much, Chair. Honorable Ministers, Your Excellencies, let me start by saying Mulibwanji. Okay. It's a pleasure to introduce the document entitled Regional Framework for Accelerating Implementation of the Global Oral Health Action Plan. So the whole idea is to start by providing the rationale for this framework and then summarize briefly what the framework is all about, and then highlight some of the priority interventions and actions that are required for all our member states to attain the oral health goals. So there are 4 reasons for the development of this framework. The first one is really the policy reasons. There is a global strategy on oral health, which was adopted by the World Health Assembly. This was translated into a regional framework for implementing that document. And then the document will be ending this year. So we need a new document to drive the oral health agenda in this region. The last one is the commitment to the Bangkok Declaration on Oral Health, which was adopted by member states last year. The second reason is really epidemiological reason. There are almost 40% of the population in this region which are affected by oral health. And then oral health diseases share common risk factors with other NCD. And then the last one is really the burden of NOMA in this region, the need to address NOMA in this region. The other 2 reasons are economic and human rights, and they are listed here. In terms of in terms of progress made in this region, we are 14 countries with national oral health plan policies. We also have close to 40,000 community health workers who have been trained. There are some challenges that we are facing. One is the limited investment in oral health. The second one, the focus on curative care, other prevention and promotion. And then the last one is really the shortage of oral health care workers. In terms of priority interventions, they are grouped into 5. One is the overarching interventions, which should focus on reducing the oral disease burden. And then the second one is really the governance. We are expecting all member states to come up with national oral health plans, which can be costed and serve as a basis for resource mobilization. The third one is the need for promotion on oral health, but also disease prevention. The third one is the need for strengthening oral health workforce in this region. And lastly, the need for oral health care. So these are the 5 interventions that we are suggesting. And with that, we are inviting the regional committee to review and adopt the proposed framework for implementation of global oral health plan in this region. Thank you, Chair. Zikomo, like we say in Nyanja. Thank you.
Thank you. Thank you very much. I now open the floor to member states' interventions. Quite many. I think start from the side. Togo, followed by Mauritania.
Merci, Monsieur le Président, Monsieur le Directeur Régional.
Thank you. To thank the Secretariat for the quality of this regional framework to work on improving oral health so that we can overcome the challenges. Togo adheres to the vision and the
Le Togo fait de la lutte contre les maladies non transmissibles, y compris la santé bucco-dentaire, une de ses priorités. L'a inscrit dans son plan national de développement sanitaire.
Priority on our national health agenda of 2023 to 2027. Therefore, Togo would like to say that oral health is very important, especially with communities. We need to work on outreach, and we would like to support the Bangkok Statement on oral health care, which was adopted by the first WHO meeting on oral health. Togo agrees with the vision of integrating oral care into the entire package and ensuring health for all, and also that it is in line with the regional and global frameworks so that we can combat NCDs and the plans that relate to it accordingly. Togo would like to say that it's important to have political commitment, to commit financing, to have strong partnership, and to have inter and multi-sectoral partnerships so that everyone will be having access to optimal oral care. Togo would like to support the measures that are proposed in this framework. Thank you, Chair.
Ghana, Mauritania, followed by Ghana.
Thank you, Mr. Chair. Mauritania has considered with a lot of interest the measures that have been proposed, and would like to congratulate the Secretariat for the quality of the Global Action Plan for Oral Health that has been proposed, which seeks to address oral diseases, to address non-communicable disease in order to converge towards universal health coverage and health for all by 2030. Oral health is an underfunded program in countries and their links to non-communicable diseases. The major challenges are related to insufficient and unfair distribution of skilled workers and on a vast territory, and the mobility of the nomadic people, there's an seasonal agro-pastoral economy, the lack of infrastructural equipment. Accordingly, in 2025, when developing the new strategic plan of oral health 2030, strategies were developed. The development of the treatment protocol, the integration of oral treatment in the health
clinique mobile en collaboration avec le programme santé communautaire. Nos engagements en faveur d'une couverture sanitaire universelle nous exhortent à œuvrer davantage pour réduire les barrières financières d'accès aux soins en particulier
to health, especially
souvent très onéreuse et axée essentiellement sur les curatifs. Aussi, l'accroissement du financement, l'intégration effective des soins de santé bucco-dentaire dans l'offre de services et leur prise en charge dans le système
and the management while seizing the opportunities and innovative strategies such as digitalization and the strengthening of research are priority areas that have to be taken into account in our strategy. Mauritania would like to adopt the measures proposed, and I'd like to thank you.
Thank you. Ghana, followed by Ethiopia.
Thank you, Mr. Chair. Ghana appreciates the opportunity to take the floor to contribute to Agenda Item 7. We commend the Secretariat for the new strategic framework that take cognizance of the previous strategy and adopt key aspects of the Global Oral Health Action Plan 2023 to 2030 to our regional context. We welcome the strengthening of oral health functions across all health systems pillars using a people-centered approach while adopting a more integrated approach to NCDs. Chair, oral health is integral to general health and well-being, yet it has been long neglected. In Africa, nearly 42% of our people live with preventable oral diseases. These conditions share common risk factors with other major non-communicable diseases, including diabetes, cardiovascular diseases, and cancers. Ghana therefore welcomes this regional framework, which rightly calls for stronger leadership, sustainable financing, innovative workforce models, and integration of oral health into universal health coverage. In 2024, with WHO support, Ghana conducted a rapid oral health situation assessment, developed a national oral health scorecard, and initiated work on national oral health strategy to be finalized by the end of 2025. Through our national health insurance scheme, some dental services are already included, yet coverage reaches less than 40% of our population, with inequities across rural and peri-urban communities. In conclusion, Chair, Ghana endorses the regional framework and urges collective action to accelerate progress. We call on partners to 1, support sustainable finance mechanisms, including health taxes and innovative resource mobilization to close the oral health investment gap. 2, to facilitate local production and fair access to essential dental medicines and fluoride-containing products. And lastly, invest in workforce innovation, including task sharing with community health workers to extend coverage to underserved communities. Thank you.
Ethiopia, followed by Congo.
Thank you, Mr. Chair. Ethiopia would like to thank the Secretariat for introducing this framework and for driving the oral health agenda in the region. Ethiopia duly acknowledged the concern expressed in the report regarding the limited attention, integration, and underfunding of oral health in spite of the substantial magnitude of the oral health problems. Limited integration of oral health into national NCD policies and service package, lack of sustainable financing, and the limited public awareness the burden and economic cost of untreated oral diseases are also among the major challenges in Ethiopia. Ethiopia supports the proposed framework and stands ready to collaborate with WHO partners and other stakeholders for its implementation. Our immediate and future efforts will be geared toward a sound oral health policy, roadmap and program, strengthened leadership and coordination mechanisms, enhancing public awareness and adequate integration with primary health care. We also take note of the shared risk factors and the direct links with NCD, which warrants the integration of oral health with the broader NCD prevention and control. It's our sincere conviction that WHO's commitment and support in creating an enabling environment through advocacy, partner coordination, resource mobilization, technical assistance, and capacity building will remain in force in the realization of the framework. We look forward to collaborating with other member states for experience sharing and joint learning. I thank you.
Congo, followed by Malawi.
Mr. Chair, Congo would like to congratulate the WHO Secretariat that proposed this regional framework. The epidemiological analysis for oral health in our country in the scope of the situation and confirm the limited access to most of the population without oral health, and even at the essential services, due to their prohibitive cost. Due to these concerns, several initiatives have been undertaken in the country to effectively address the disease and oral diseases by the scientists and public authorities with support from technical and financial partners and NGOs operating in Congo. This initiative hinges on the National Health Development Plan and are aligned with the Global Action Plan on Oral Health. Implementation is geared towards universal health coverage in order not to leave anybody behind for health for all by 2030. In order to improve health services, Congo revised its vision, including oral health in the minimum activity package in primary healthcare. At the heart of this initiative, you have the law on the health insurance, universal health insurance, that was promulgated in 2024, which gives rights to health services for all Congolese without financial restrictions. Congo is part and parcel of the global strategy on oral health adopted in 2022 during the World Health Assembly for universal health coverage for all individuals and for all communities by 2030, and also adheres to the moratorium of the Minamata Convention, committing the country to the gradual reduction of dental amalgamation. The Republic of Congo also subscribed to the BOCOP Declaration in 2024. Despite the non-achievement of the targets of the national strategy 2025 and 2005 and 2025, and aware of the stakes, Congo undertakes to strengthen its efforts to improve oral health of the population. Thank you very much.
Malawi, followed by Cabo Verde.
Chairperson of the Regional Committee, I would like to thank you for affording Malawi the opportunity to join other countries in appreciating this new framework that seeks to accelerate implementation of the Global Oral Health Action Plan by indeed putting oral diseases as part of NCDs towards universal health coverage by 2030. Malawi's current national strategic plan recognizes and adopts this approach that no one should be left behind, including those that have to deal with oral health problems. And Malawi proudly, even now, reaffirms its commitment to the Bangkok Declaration and the Global Oral Health Action Plan that runs up to 2030. And indeed, guided by this determination, in 2022, Malawi took a historic step by launching the first national oral health policy and implementation plan of its own, with a pledge to all our people to have oral health as close to where they live as possible. We therefore recommend this framework, as well as the Secretariat and the mentioning of equity, prevention, and integration in its delivery. We have begun embedding all these in the Malawi context. Indeed, it has been included in the WHO Pain Plus strategy at primary health care level, ensuring that dental services are not confined only to urban centers, but that they reach communities where these communities are living. We are also integrating oral health indicators in our national health information system to make sure that we can also hold ourselves accountable to what we need to achieve. We are encouraged by recent progress. The National Child Health Survey has been done, including the recognition of NOMA as a neglected tropical disease. In response, a multi-sector child oral health task force has been set up in schools, and it is strengthening child-focused strategies. In April 2025, Malawi also celebrated another first milestone, which is the first cohort of homegrown dentists were actually qualified in the country. It is the construction of our first dental school in Blantyre with a curriculum that is able to distribute professionals to underserved rural regions. It is for these that we would like to support and endorse this framework and call upon all other member states to join this to ensure that no one will be left behind by 2030. I submit.
Followed by DRC.
Excelentíssimo Senhor Diretor-Geral e Regional da OMS, Senhor Presidente do Comitê Regional, distintos ministros de saúde e chefes das delegações, ilustres representantes das organizações parceiras, senhores e senhoras.
No interpretation.
É com elevada honra e sentido de responsabilidade que a delegação de Cabo Verde,
the high level of responsibility that the Cabo Verde delegation is joining this session. I'd like to once again greet all the participants and reaffirm its commitment for public health in our region. We'd like to thank the organization for who share the stakes and the experiences and the challenges of our country in the spirit of collaboration that binds us. In this slide, is 2022-2025 strategy, which focuses on the reduction of oral health and give priority to preventive actions in schools due to the high level of exposition of children to products, sugar products. We implemented awareness-raising campaigns in order to improve hygiene and oral conditions. As regards this, Cabo Verde was included in the first WHO report, and this report details the major factors such as the food diet rich in sugar and the lack of access to oral health care. So the access of less than 50% of the population to oral health care and the reduction by 10% of oral health disease prevalence. The current challenges include the high prevalence of oral disease burden, the low prevalence of visits to dentists. 40% of the population consult been to see the dentist in 2 years. The objective is to improve oral health, train more dentists in awareness, and thank you very much for your attention.
Thank you. DRC followed by Burundi.
Merci, Monsieur le Président.
Thank you, Mr. Chair. The DRC would like to thank the Secretariat for the work that they have done. After having participated in the first global meeting on oral health in December 2024, and that led to the Bangkok Declaration, the DRC reaffirmed its commitment to accelerate and intensify efforts to prevent and control non-communicable disease, especially oral health, in order to achieve universal health care by 2030. To achieve this, a roadmap, implementation roadmap of the global strategy was developed with the support of the WHO and focuses on the following priorities: improve access to essential services of oral health, reduce support policies to reduce consumption of sugar, define national policy in the health workforce, including skilled personnel trained in oral health needs, and report on the 11 objectives on the oral health. The DRC is finalizing the National Strategic Plan on Oral Health 2025 to enable the mobilization of necessary resources to advance national agenda on oral health. With regard to motor sector, the Ministry of Higher Education has just launched the training sector in oral health to improve research on oral health in the country. We are convinced that with the support of everyone, we'll be able to stop the progress of oral disease for Africa in better health. The DRC recommends other states to adopt this report. Thank you.
Thank you. Burundi followed by Angola.
Thank you, Mr. Chair. Ladies and honorable ministers, distinguished heads of delegation, the government of Burundi would like to reaffirm its commitment to the oral health regional strategy, which underscores the importance of considering oral diseases as part of the non-communicable disease. It recognizes that high sugar diet we are aware of the importance of strengthening governance, skilled human resources, providing data to guide interventions. Since the Bangkok Declaration, Burundi has made concrete this commitment through a roadmap on 3 main thrusts: the strengthening of governance in oral health, and with the development of specific task work and allocation of resources in oral health in our country. We also develop human resources by establishing training in oral health in our schools in order to prepare a generation of skilled professionals. We also improve the data quality and research by strengthening the capacity of data generation in our health unit and to ensure the continuous training of health workers involved in oral health. Mr. Chair, Burundi is preparing itself to develop its first national strategic plan on oral health in order to better respond to the increasing burden of oral disease among our population. Mr. Chair, Burundi fully supports the draft resolution on oral health and encourages all member states to strengthen regional cooperation to achieve more resilient health and inclusive health systems. Thank you very much.
Thank you. Angola followed by Nigeria.
Muito obrigada, Senhor Presidente. Excelência, Senhor Presidente da sessão do Comitê Regional da OMS, Excelência Ministros da Saúde.
The Chair of the Regional Committee, Honorable Ministers, the Regional Director of Africa, I'd like to congratulate the Secretary for this excellent document on oral health. This is essential in providing healthcare, especially as concerns primary health, focus on young children. We also like to congratulate or appreciate the initiative to develop this framework. This is hard and corresponds to the oral health development plan. To tackle this, Angola has adopted measures to achieve this action plan and to operationalize it with an approach with a people-centered approach in order to achieve universal health coverage in the country by 2030, making available the oral health services coverage, 100% coverage of our municipalities with oral health services, as well as and ensure that they are free. Moreover, special efforts should be made to make available qualified or skilled health professionals in the area of oral health within the framework of emergency project of 38,000 health workers. We are now strengthening the surveillance of oral health services and the implementation of epidemiological vigilance. We have also launched the implementation of an action plan that will take us to 2030. And this has witnessed the increase of oral health budget. With special focus on oral health. We are also working on the national strategy to promote oral health with a more integrated approach in non-communicable diseases. We support this plan and we invite members to support this plan and leave nobody behind.
Thank you, Chair. Nigeria recognizes oral health as essential to overall health and well-being, and the importance of addressing oral diseases as part of non-communicable diseases towards universal health coverage. Oral diseases are not only a matter of dental care, but they are also closely linked with the broader NCH burden, including diabetes, cardiovascular diseases, and cancer. Neglecting oral health undermines progress towards universal health coverage. and the Sustainable Development Goals. Nigeria has taken significant steps to drive oral health as a national priority. These actions cut across the recommended priority interventions and actions for countries in this framework. We have doubled the number of intake into our training institutions in dental specialties, and we have a national oral health policy being reviewed. We urge countries to look inwards for innovative financing mechanism to fund these priority actions, enhance regional collaboration to share best practices and innovations in integrating oral health into primary health care, to support sustainable financing mechanism for oral health interventions, particularly for underserved and rural communities. And we need to enhance technical assistance for policy implementation, research, and workforce development in oral health. It is imperative to promote joint action on oral health within the broader non-communicable disease spectrum of universal health coverage and One Health framework. Nigeria remains fully committed to advancing oral health as a key pillar of universal health coverage. We support this framework for global oral health. Thank you, Chair.
Merci. La Mauritanie a la parole.
Thank you. Mauritania has the floor, and Zambia would follow thereafter.
La Mauritanie a déjà intervenu.
Donc, la Zambie.
Zambia, the floor is yours, and that will be followed by Mozambique.
La Zambie.
Zambia, you have the floor.
Mozambique.
Mozambique.
Thank you very much, Chair. Firstly, I would like to congratulate the excellent report presented. Mozambique has implemented activities so that we have an integrated approach to combating NCDs and communicable diseases. It is urgent for us to accelerate our efforts in terms of oral health, looking at the general context. We need to look at the commitment that we have so that we move forward with oral health. We need to strengthen partnerships to support oral health with NGOs and bilateral partners and different companies. We are carrying out national campaigns in schools and in the community. We have been screening for oral diseases, and we have been working in schools so that we can look at the issue of supervising oral care, that we have fluoride toothpastes so that we can control our oral diseases and expand our outreach so that we can improve on our figures from 2024 going forward. We have been working on various techniques and strategies so that we can go beyond the area of oral health and work in partnership with other areas. It is very important for us to update our information networks and databases so that we can have evidence-informed policies and strategies. This will then help us to achieve a paradigm shift so that we can have a treatment which is looking at preventive measures in improving oral health. We need to look at the social context and look at what activities we can do so that we can achieve better UHC in oral health. We need multi-sectoral activities. We need to work with multi-sectoral partners so that we can support and provide capacity building so that we have a better coverage of oral health, specifically within the communities. This is an important public health action. WHO would like to support this important document, and thank you for your kind attention.
Zambia est là.
Thank you for giving us the opportunity to speak. We too endorse the way forward being suggested because it will improve our context. Zambia has a high burden of oral diseases. Oral diseases are among the 8 top causes of mortality in our country. However, Zambia is committed to reducing the prevalence of oral diseases. As part of this commitment, Zambia surpassed its target of reducing the prevalence of oral disease to 70% by 2026. We are actually at 67% in 2025. How did we do this? First, we are implementing the Global Oral Health Action Plan prudently. Second, we are integrating oral health into the mainstream management of non-communicable diseases. We are focused on prevention of oral disease by targeting the determinants of oral health, such as sugar consumption, tobacco consumption, and alcohol use. We are also promoting the use of the World Health Organization recommended essential oral products. We target to completely phase out the use of dental amalgam by 2030. We are training healthcare workers at all levels of our care. We are also decentralizing oral health services, including taking these services to where people work, live, and go to schools. Zambia invites partners to support these efforts to improve oral health in our country. I thank you.
Liberia, and Mali will follow.
Liberia endorses the report of the Secretariat on the Global Oral Health Action Plan, as well as the Regional Oral Health Framework 2025 to 2030. Non-communicable diseases, including oral health, remains a major health burden in Liberia, causing 38% of disease burden, 60% of hospitalization, and 43% of death from 2016 to 2023. Additionally, over 40% of the population in Liberia are affected by oral diseases. The Ministry of Health has begun the integration of oral health services into primary health care. Liberia is among the African countries with a national oral health roadmap in which focuses on health facility-based care, school outreach services, community awareness, and the use of mobile technology. There is, however, a severe shortage of oral health professionals in a country with limited infrastructure, medical supplies, and equipment to provide oral health care. Efforts are currently ongoing to train Liberia professionals in the sub-region in the industry as a short-term intervention to establish dental training in country at existing medical and paramedical training institutions. We again confirm our commitment to implement and recommend interventions, encouraging other member states to do likewise. Thank you.
Le Mali, le Bénin se prépare.
Mali and Benin will follow.
Merci, Madame
Thank
la
you.
Vice-Présidente.
Thank you.
Messieurs les membres du comité. Le Mali félicite le secrétariat pour la qualité du rapport relatif au point 7 de l'ordre du jour. La santé bucco-dentaire est le socle de notre vie, car nous permet d'exercer des fonctions essentielles
The implementation of the Global Oral Health Action Plan, and this really will impact our health and our well-being. Oral diseases such as dental caries and NOMA are very widespread in the African region in particularly and also globally. Mali has come up with a plan for 2023 to 2027. We are focusing on caries, on periodontal diseases, mouth cancer and throat cancer, NOMA, HIV impact on on oral health, facial diseases. And if we look at our profile, 30% of our population had dental caries in 2019. Since we have been implementing activities and the strategic plan 2023 to 2027, we have had problems in the area of financing. Mali would like to adhere and subscribe to the adoption of this report by the regional committee. Thank you. Benin, and next will be Burkina Faso. Madam Vice Chair, Benin would like to congratulate the Secretariat for this regional framework for accelerating implementation of the Global Oral Health Action Plan 2020 to up to 2030, which this focuses on the main oral diseases and the pedigree of finances. This is a challenge that faces all of us. It is a huge challenge. It is a public health challenge for all of us in Africa. And this is why we have integrated oral health into the essential health care and the training that we carry out every year. We do have some outreach activities so that we can detect oral diseases. We have also deployed since 2021 dental surgeons and we so that we can improve the access and supply of the oral health, especially in the period coming forward. More than 500 community health workers have been trained in Noma, which is now recognized as an NTD. So oral health has been integrated into routine services. In terms of oral health, we need to develop a national strategic health plan on oral health. We need to strengthen primary health care, and we have to systematically include oral health initiatives through HUPEN so that we can have training and also have task shifting and task sharing. Benin would like to reaffirm its commitment to implementing this regional framework and is calling on African countries for increased solidarity to obtain the necessary financing funding. Thank you so much for your attention. Burkina Faso, Madam Vice Chair, the delegation of Burkina Faso would like to congratulate the Secretariat for the quality of this report and would like to commend the efforts of WHO in terms of achieving UHG, covering oral health care for all in the African region by 2030. Burkina Faso has carried out important efforts to promote and improve oral health services, and it is now housed within the unit of NCD control. We have come up with a plan from 2023 to 27, and we also have a communication strategy for promoting oral health. Oral health has therefore been integrated in terms of universal access to services, and we have carried out activities in the area of oral health. Burkina Faso, in partnership with WHO, has also developed a national roadmap, which will go up to 23, which is aligned with our global roadmap. In terms of awareness raising, Burkina Faso always celebrates the Oral Health Day, and here we promote messages for oral health. We have campaigns which are targeting of the consumption of sugary drinks and also of practicing good hygiene. Considerable efforts sometimes are facing challenge because we have limited access to services, particularly in rural areas, because we also do not have specialists trained in oral care. We have lack of equipment, and also the treatment is costly. We have poor food and diet habits. This is impacting dental caries, and it's therefore important to include oral care into essential health packages and to link up with combating NCDs. The government would like to face these challenges so that oral health will not be an obstacle to the health of our population. My delegation would like to conclude by subscribing to the activities that have been recommended by the WHO in this regional framework, and therefore to adopt it. Thank you. Seychelles? Lesotho will be next.
Oral diseases are closely linked with major NCDs, making integration into broader health strategies essential. The new regional framework, aligned with the Global Oral Health Action Plan 2023-2030, provides timely guidance for prevention, integration, and universal access. In Seychelles, oral health care is well institutionalized within primary health care since 1978, with services delivered through community health centers and schools, free at the point of care. Our prevention-oriented workforce, including dental therapists and hygienists, reduces reliance on dentists. Essential medicines such as silver diamide fluoride and fluoride vanishes are readily available. Furthermore, oral health care is integrated within the Seychelles span, maternal and child health, antenatal services, and school programs. We are also in the process of adopting the WHO stepwise survey tool for population-based monitoring, and this will help us to develop our national oral health strategic plan. As a small island developing state, Seychelles strongly supports this framework and reaffirms its commitment to advancing oral health for all by 2030. Thank you.
Right.
Lesotho et Tanzanie se préparent.
Lesotho and Tanzania be ready to go next, please.
Honorable Chair, Honorable Ministers, Regional Director, distinguished delegates, Lesotho is committed to accelerating implementation of Global Oral Health Action Plan 2023-2030 and to integrating oral health as a core component of universal health coverage. For the first time, a national oral health policy has been finalized and presented to Cabinet. It has been endorsed and it provides the foundation for a comprehensive action plan aligned with our broader NCD strategy. In addition, our essential medicine list now includes glass enormous cement and silver diamond fluoride, and we have phased out amalgam from the national supply list in line with the Manamata Convention. Oral health services in Lesotho are currently concentrated in a very small proportion of our country's health facilities. Out of a total of 281 facilities, 21 provides oral health care. This includes the National Referral Hospital, 15 district hospitals, 4 filter clinics, and just 1 health center. This means that 260 facilities, or 92.5% of the system, remain without any oral health service. At the primary health care level, the gap is even more pronounced, with only 1 out of the 261 health centers offering oral health care, leaving communities underserved and forcing patients to rely heavily on high-level hospitals. This limited
service coverage is closely linked to the critical shortage of oral health personnel in the country. Lesotho faces a persistent lack of an appropriate human resource base and skill mix for oral health. For years, the country has depended on the recruitment of dentists and dental therapists from outside its borders. A milestone development, however, has been the establishment of dental therapist training program. This marks a turning point in building a sustainable pipeline of mid-level oral health professionals who are being absorbed in the system. Though uptake remains slow, their deployment is vital for
Merci, Olozoto. Merci.
primary health care.
Merci.
Thank you. Tanzania, you have the phone, and next will be Zimbabwe.
Thank you.
Thank you, Chairperson. The United Republic of Tanzania welcomes and supports the proposed regional framework for accelerating the implementation of the Global Oral Health Action Plan by 2030. We commend the Secretariat for highlighting oral health as an integral component of universal health coverage and non-communicable disease prevention. Oral diseases remain a significant public health challenge, particularly among school-aged children and in rural communities. We have taken steps to integrate oral health into our national NCD strategy and strengthened primary health care services, including through community health workers, training, and expanded outreach. Through strategic investment from 2022 to 2025, we have improved oral health coverage, and we have tripled access to oral health coverage, a major milestone driven by strong political will and leadership of Her Excellence President Samia Suluhu Hassan, in line with our commitment to universal health coverage. Tanzania has strengthened its central procurement system of dental materials, equipment, and supplies under the medical store department, including the Centurion N as a safe and effective alternative to dental amalgam in the country. We support the framework call for prevention, integration of oral health into essential services, and innovative workforce solutions. We urge WHO and partner to provide technical and financial support to address workforce and supply gaps. With sustained commitment and collaboration, Tanzania believes universal oral health coverage in Africa by 2030 is achievable. Thank you very much, Honorable Chairperson.
Zimbabwe,
followed by Central African Republic.
Thank you, Honorable Chairperson. Zimbabwe aligns itself with the progress report and commends the Regional Office for prioritizing oral health within the broader non-communicable diseases agenda, consistent with the Global Oral Health Action Plan. Zimbabwe has integrated oral health into NCD programs led by a dedicated oral health unit within the Ministry of Health. We have also introduced a sugar tax to discourage excessive sugar consumption while strengthening health promotion and funding for NCD prevention. Our achievements include the launch of a school health policy with a strategy to promote oral health in schools, the inclusion of fluoride toothpaste in our essential drug list, the development of an essential oral health package within universal health coverage to provide basic oral examinations and early referral from primary care, and the strengthening of our dental workforce with structured training for dental therapists, surgeons, and specialists. However, challenges still remain. We have limited surveillance and monitoring systems, no oral health module in our national surveys and health information systems, and
the need for a comprehensive oral health policy and strategy with a clear monitoring and evaluation framework. In this regard, technical support in finalizing our national oral health policy and in strengthening disease surveillance and research is necessary. With collective effort, we can reduce the burden of oral diseases and advance healthier lives for all in the region. I thank you.
Merci.
Thank you. Central African Republic, followed by Senegal. Thank you.
Madame la Vice-Présidente,
Madam Vice Chair, distinguished delegates,
la République centrafricaine,
the Central African Republic would like to commend this initiative of WHO looking to address oral care as a key pillar in achieving UHC. We would like to commend and thank the Secretariat for the excellent quality of this document. Our country is amongst many and we that have reached a critical stage in terms of our providing oral care at tertiary level. If we look at our hospital structures and we look at the qualified personnel, we do have some. However, the coverage is very much limited. It only covers a small portion of our population. In this regard, we think that it is a priority for us to strengthen leadership and political as resource allocation to come up with a robust oral health policy. We are urging and calling on WHO to support the Central African Republic in revisiting its program to come up with a strategic plan and setting up innovative measures to provide healthcare services which are accessible and affordable to all. We think that together with increased support that we can reduce the burden of oral health and therefore contribute fully to the development and the health and well-being of Africa. In this regard, the CAR would like to adopt the measures and actions proposed. Thank you. It's the form, and next will be Comoros. Madam Vice Chair, distinguished delegates and ministers, this year is an important milestone for the oral health stakeholders. WHO would like to commend the development of this regional framework because this will really help us to move forward in this area. It is a guideline to help countries to be committed to pursuing our efforts to promote oral health, because this is one of the key pillars in achieving health for all. Senegal has a strategic plan 2022 to 2026, which is aimed at improving oral care and its access and to integrating it on a public health care perspectives. We also need to look at the community level so that we can manage oral health care. We need to improve the quality of our equipment and our commodities in combating oral diseases, taking account of socio and commercial determinants. We need to integrate oral health within the context of combating NCDs, non-communicable diseases. Senegal would like to congratulate the regional committee for developing this framework and invites the African member states to take ownership of this regional framework. Senegal would like to stress its commitment to working together with WHO and its partners so that by 2030 we will have a much more robust system in terms of oral care and beyond. Thank you, Senegal. The floor now goes to Comoros, and next will be Sierra Leone.
Thank you very much, Madam Chair. Sierra Leone welcomes the regional framework for accelerating implementation of the Global Oral Health Action Plan. We as a country, we recognize the burden of oral diseases and their impacts on the overall health of our people. The country is however, committed to addressing this burden through following strategies. Community-based prevention efforts. The ministry is embarking on awareness-raising activities to increase community awareness on the prevention and care seeking for oral health conditions. The awareness-raising activities focus on raising awareness about oral hygiene practices and reducing risk factors like high sugar consumption and tobacco use. Secondly, integration of oral health services into primary health care. Primary health care facilities are being supported to undertake community sensitization on oral health issues and linkage to care in higher level health facilities. Thirdly, capacity building. The Ministry of Health is undertaking the training of healthcare workers in oral health promotion, prevention, and basic treatment. Over and beyond, we are also at the point of establishing a dental school so that we can train our own local practitioners in country. Policy development, which is the driver for all of what we are talking. Sierra Leone has developed the National Oral Health Strategy this year and was launched by His Excellency the President at the National Health Summit this year. This strategy aims at providing an enabling environment, the requisite human resource, the infrastructure supplies, and the guiding policy to ensure that oral health strategies are well implemented. Sierra Leone remains committed and supports fully the document that is being presented on accelerating services regarding oral health. Thank you very much.
Merci. Comorella.
On n'a pas demandé la parole, madame.
On a Guinée-Bissau.
Obrigado, senhora vice-presidente. A Guiné-Bissau aproveita esta oportunidade para agradecer mais uma vez
to thank WHO once again for all their efforts, their ongoing efforts to strengthen health systems in our respective countries and for uniting around
a saúde oral. Apesar de ser muitas vezes subestimada,
very often it is neglected and overlooked, but oral health is an integral part of general health and well-being for our populations. Problems such as dental caries, periodontal diseases, and the loss of teeth obviously has an impact on the quality of life of people in terms of nutrition and performance in schools, and also the mental health of the population. In Guinea-Bissau, we recognize that there are significant challenges that we are facing in this area. Our country, perfect policy and at the national level on oral health, but we have continued to persist with our efforts to reduce oral health problems through awareness raising campaigns regarding oral health and hygiene in schools and in communities. We are training professionals, including nurses, technical health workers, and community health workers. We are briefing them to identify cases involving oral health. We need to invest in the training of dentists, and we need to adopt national policies which will be guiding our activities in the sector. We also need to invest in infrastructures and also access to equipment and commodities. we also need national efforts made so that this sector registers progress. Oral health and access to it should not be a privilege, but a right accessible to all. In this spirit, with this will, we would like to reaffirm our commitment to Agenda 2030 and also achieving universal health coverage, where oral health will have its due place. Thank you very much. Rwanda, and followed by Eswatini.
Thank you, Madam Vice Chair. Rwanda acknowledges the regional framework for the accelerated implementation of the Global Oral Health Action Plan, which provides a critical roadmap for advancing oral health across Africa. We particularly welcome its emphasis on integrating oral health into broader health priorities, including non-communicable diseases, strengthening health systems, promoting community-level interventions, and ensuring equitable access to services. Rwanda has made significant strides in implementing these principles with key actions including integrating oral health into primary and secondary school curriculum, decentralizing oral health services to health centers and second-generation health posts, conducting regular community-based oral health screenings, including dental services in the community health insurance benefits package. We're also currently exploring local production of toothpaste. We're organizing cleft palate repair surgeries at national level and building the capacity of our dental healthcare professionals. In this context, Rwanda supports this important framework and believes that its implementation will contribute to improving oral health across our continent and universal health coverage outcomes more broadly. Thank you.
Merci beaucoup.
Thank you very much. Eswatini and Namibia, please get ready.
In Eswatini, oral health services are provided at primary, secondary, and tertiary level through the adoption of a package of services that includes awareness campaigns carried out through outreach services. At primary care level, school health nurses play a vital role in identifying and referring school learners with oral health problems and refer them to dental therapists and dentists at higher level facilities. The ministry has also formed partnership with NGOs and private entities such as rural populations. Strengthening the oral health workforce is becoming critical. In light of the reduction in numbers of the cadres, such as dental hygienists and therapists, who are vital in providing primary care level oral health services. Eswatini is working on aligning oral health with NCD prevention priorities through leveraging WHO's Global Oral Health Action Plan of 2023-2030. We appreciate this report and recommended the following. 1, strengthen oral health literacy campaigns to drive demand for services. 2, update and implement a funded national oral health policy aligned with the new regional framework. 3, mobilize multi-sectoral and political support to prioritize oral health within NCD and UHC agendas. Thank you.
Merci beaucoup.
Thank you very much. Namibia, followed by Madagascar.
Thank you very much, Madam Chair. Much has been said, Chair, with regard to this framework and the basic tenets that we need to have in place to have a functioning oral healthcare system. And Namibia aligns with much of the commentary that has been said, Madam Chair. We welcome this regional framework for accelerating oral health action within the non-communicable diseases towards universal health coverage by 2030. We commend the Secretariat, just like what other delegates have put forth. We commend the Director General. We commend WHO and member states for prioritizing oral health as a key component of the non-communicable disease agenda. And indeed, Chair, oral health is central to overall health and well-being. It is both a major public health challenge, as other delegates has zoomed in on this matter. It is a critical entry point to advance prevention, to advance equity, and to integrate oral health within the primary healthcare and universal healthcare continuum. Namibia has seized the opportunity to integrate oral health into the National Non-Communicable Disease Prevention and Control Program. Efforts have commenced at the national level, and we have been implementing programs to that effect to align oral health within the WHO-supported PEN guidelines. Chairperson, in accelerating progress, Namibia underscores the following priorities as important for the framework and for the strategies going forward. Updating the national policy and legislative frameworks, taking into account regional and global best practices, local context, and homegrown solutions. Institutional strengthening and governance towards a fully functional oral health delivery office with the requisite support mechanisms to enhance coordination, to enhance accountability and visibility nationally. 3, securing sustainable financing through advocacy for a dedicated program budget for essential oral health commodities and service delivery. And 4th and last, the aspect of capacity building, which is really cutting across, Madam Chair, and the aspect of integration, ensuring that oral health is embedded into the non-communicable disease prevention and control, that is embedded in the primary healthcare outlay at the country and the regional level, and to ensure that is embedded in the overall health promotion interventions. So with these comments, Chairperson, Namibia fully supports the proposal. Thank you.
Madagascar.
Madagascar, you have the floor. Thank you very much, Madam Chair. Madagascar would like to congratulate WHO for the quality of the report. And we actually subscribe to it. Madagascar affirms its commitment to strengthen the control of non-communicable disease in oral health. Oral health is part of the Milcom package of activities in basic health centers in Madagascar. In the general policy of the state 2024-2028, it was decided to set up dentistry centers and to commit to recruit dentists that provide services. In implementing the general policy of the state to implement the mobile clinic activities and medical caravans that are outreach activities that we promote, we provided care, oral health care to meet the needs of the community, especially those in remote areas or that are hard to reach. We have just developed a national oral health strategic plan, which is the first strategic plan designed in Madagascar, which affirms its promotion. This document will soon be validated, and the important points that were presented earlier form the guidelines. We also have a special prevention program through education and healthy lifestyle. As the efforts that were undertaken, we undertook an OV prevalence survey last March that enabled us to know the magnitude of the situation in oral health. Madagascar therefore reiterates its commitment to redouble its efforts by strengthening oral health care among the population to contribute to the oral health in the African region. Thank you very much. Thank you, distinguished delegates. I think there is no further request for the floor. And now I would like to invite the representatives, member states, and other regions, and the United Nations systems, and other intergovernmental organizations that would like to speak to raise their nameplates. I'd like to remind you that you have 2 minutes for your interventions.
Donc, il n'y a pas d'observation.
Would appear there are no observations. Thank you then for your attention. Does the Secretariat have observations to make? Since several non-state actors that have decided to deliver statements during on this agenda, if they are present, please, they can proceed and deliver their statements. The Joint International for Dental Surgery and the International Dental Federation.
Thank you. The International Association for Dental Oral and Craniofacial Research and the FDI, World Dental Federation, representing over 10,000 researchers and 1 million dentists worldwide, commend member states for prioritizing the regional framework. Oral diseases are among the most prevalent NCDs and cause pain, disability, and economic loss. In parts of Africa, barriers to care are greatest, with fewer than 10% of people in low-income countries accessing essential oral health services. We urge retaining and strengthening the recognition of oral diseases in the political declaration on NCDs with measurable targets from the Global Oral Health Action Plan. 1, at least 50% of population entitled to essential oral health services. 2, 50% of countries implementing free sugar reduction policies. And 3, 50% of countries have a national oral health research agenda. To achieve this, we call for action on commercial determinants of health, full integration of oral health into the universal health coverage, benefit packages, and primary care, and investment in Africa's workforce surveillance and research capacity. Thank you.
Merci.
Thank you. The Alliance on MNT.
Oral health in Africa is one of the most neglected areas of public health, with 42% of people affected by preventable oral diseases that share risk factors with major non-communicable diseases. Over 70% of people in member states spend less than $1 per person on oral health, far below the global average. Only 17% of the population has access to essential services. Just 9% of countries have optimal fluoride guidelines. Preventive measures and integration into primary care are limited. We welcome the development of the framework and its targets, and on behalf of NCD Alliance and the Africa NCD Network, we recommend the member states to ensure access to affordable fluoride toothpaste through national guidelines, integrate oral health into NCD and universal health coverage strategies, including WHO PEN, shift focus from treatment to prevention, add essential dental medicines to national lists, strengthen the health workforce. We therefore say there is no health without oral health. Thank you very much.
Merci.
Thank you. The Federation of Association of Medical Students in Africa, FAMSA.
Distinguished delegates, while the regional oral health strategy of 2026 laid critical ground on oral health care, gaps remain in implementation. The African Youth call for WHO and member states to co-create regional digital oral health equity dashboard together with the youth to track access and outcome across continent. We need to include oral health indicators in national non-communicable disease monitoring and 5% of its budgets to oral health. Lastly, we need to launch public-private partnership to improve access to fluoride and screening tools. As FAMSA, we are committed to strengthening the youth engagement with the WHO African Union under the leadership of Professor Muhammad Jamabi. Thank you.
Merci pour votre
Thank you for your attention. I can't see any further requests for the floor. Does the Secretary have observations to make? Thank you very much, Madam Chair. We have recorded 28 interventions of member states and 3 interventions from non-state actors. This means that it shows the importance accorded by the Ministry of Health on this topic, which is very important for our region. So what comes out of these discussions that everybody agrees that it's a major public health emergency, but unfortunately it is neglected and underfunded in the region. What comes out of this discussion as well is that there are so many good initiatives that are going on in countries that warrant that they be shared among the various countries during South-South co-op. One of the points that was raised here was the need to conduct surveys, basic surveys on oral health in countries. The second is the need to have policies and action plans as well as strategies related to oral health. They need to design an action plan or a strategy that is budgeted for and that can serve as a basis for mobilizing resources that are required for implementing interventions in oral health. One of the points that also came out of these discussions was the need in ministries to have a unit or a body that will be responsible for managing oral health issues. This can be a fully fledged unit or a unit that is under the non-communicable disease control. Another point that also came out was issues relating to capacity building. There are countries that have the necessary expertise. There are others that plan to develop or create faculties that will be responsible for coordinating training in this area. And then the last point is on the need for developing public-private partnership, the need for collaboration with the WHO for technical support in these various areas. And finally, we have the issue of monitoring and evaluation, the issue of generating information and data that are quite important for decision-making based evidence-based decision-making. We take into account all these interventions and ensure that there will be a summary that we shared with all the countries. On this note, the Secretary would like to thank you for all these very relevant interventions, and I return the floor to the Chair. Madam, thank you very much for your attention. The Secretary has taken due note of the recommendations made, and is the regional committee ready to adopt the Global Oral Health Action Plan addressing oral disease as part of non-communicable disease toward universal health coverage and health by 2030. I don't see any objection. It is so decided.
Donc, Mesdames, Messieurs.
Okay, ladies and gentlemen, we still have one agenda item that we haven't considered yet. So I propose that we can continue the proceedings despite the lateness.
Donc, Mesdames, Messieurs, nous allons maintenant passer
Now we're going to move on to an agenda item under Pillar 1, the agenda item 10 on the agenda title Framework to Advance Universal Effective and Quality Assured Blood Products in the WHO African Region 2026 to 2030. The containing document is
J'invite le Dr Abdelai Onyango, directrice par intérim du groupe organique système des services de santé, à nous présenter le document. À vous, docteur. Vous avez 5 minutes.
the document. Over to you, Dr. Onyango. You have 5 minutes.
On behalf of the Secretariat, I have the privilege to introduce document AFR/RC75/7 entitled Framework to Advance Universal Access to Safe, Effective, and Quality Assured Blood Products in the WHO African Region 2026 to 2030. Blood transfusion is a critical component of modern healthcare. It saves lives in emergencies, supports complex surgeries, and is essential for managing conditions such as postpartum hemorrhage, severe anemia, trauma, and chronic diseases like sickle cell. Yet, despite its importance, the African region faces a severe and persistent shortage of blood. The statistics say it all. In 2022, the region collected just 5.2 blood donations per 1,000 population, and this is only half of the WHO recommended minimum of 10 people per 1,000. While 68.4% of donations came from voluntary non-remunerated blood donors, only 18 countries have reached the regional target of 80%, and just 13 have achieved 100% voluntary blood donations. In addition, less than 60% of whole blood donations are processed into components. This is suboptimal use of donated blood. Furthermore, only 14 countries have a national hemovigilance system, and just one country, South Africa, produces plasma-derived medical products locally. These gaps are not just numbers. They represent lives lost and compromised due to the unavailability of safe, effective, and quality-assured blood products. So this framework we're presenting today is a direct response to these challenges. It builds on the 2020-2023 Global Action Framework and aligns with WHO's 14th Global General Program of Work. It outlines 6 strategic objectives. 1, strengthening governance and regulatory oversight. This would ensure that there's effective leadership and accountability. Securing sustainable and financing and increasing especially domestic investments in blood services, upgrading infrastructure and equipment, which includes using innovative technologies such as drones, building the human resource capacities of blood service personnel and clinicians, improving data systems for evidence-based decision-making and monitoring, promoting voluntary blood donation through education, community engagement, and awareness campaigns. The targets are ambitious but achievable. By 2030, we aim to reach 7 donations per 1,000 population, ensure 80% of donations are from voluntary non-remunerated blood donors, and achieve 100% screening for transfusion-transmitted infections. We also aim for all countries to implement national clinical guidelines for the appropriate use of blood and blood products, and for at least half to establish national hemovigilance systems. In conclusion, this framework is not just a technical roadmap, it is a call to action. Rather, it's a call to action. It's a commitment to ensuring that no patient in our region is denied life-saving care due to a lack of safe blood. I invite you to consider the proposed actions and recommend the adoption of the framework by the 75th session of the Regional Committee. Thank you.
Merci beaucoup, docteur. Donc,
thank you very much. I now open the floor to member states' interventions. Lesotho, you have though, followed by Angola.
Honorable Chairperson, Honorable Ministers, Regional Director, distinguished delegates. Lesotho fully supports this regional framework and recognizes the urgent need to strengthen blood transfusion system. In the past financial year, our country faced a 48% shortage of blood and blood products, worsened by the absence of good laboratory practice and good manufacturing practice standards, hence the need for WHO Afro-technical support. To respond, the Minister of Health has significantly strengthened the Lesotho blood transfusion services. We have increased staffing by 89%, including donor recruiters, phlebotomists, and laboratory technologists, raised the departmental budget by 25%, expanded the vehicle fleet by 50% to improve outreach and distribution, and decentralized services with 5 of the 10 planned district allocation sites already operational. There is a high political commitment to ensure that citizens get safe blood and blood products timely. In the last blood donation day, the majority of the parliamentarians, including me, participated to encourage voluntary blood donation. Our next step are to operationalize all district collection sites, establish full good laboratory practice and good manufacturing practice compliance, and strengthen donor education and vigilance systems. Chairperson, Lesotho remains committed to the WHO Regional Framework 2026-2030 and to ensuring universal access to safe, effective, and quality assured blood products, contributing to universal health coverage and sustainable development goals. Thank you.
Merci beaucoup.
Thank you very much. Lesotho, Angola, you have the floor, and that will be followed by Benin.
Thank you very much. I would like to say that Angola would really like to congratulate the Secretariat for preparing this paper on the framework on advanced universal access to safe, effective, and quality assured blood products in the WHO African region. Of the VNRBD, it's 0.3% per 1,000 inhabitants per year. The objective of our country is to progressively reach the 16.2% per year. In this way, we'll contribute to achieving the objective of 70%. In order to achieve these statistics, we will need to mobilize about 300,000 donors per year. Our country, in our country, it is mandatory to have the TTIs, the or mandatory ones screened. And this will help us to go beyond the target of 99%, which is prevailing at the moment. We are carrying out activities to make sure that we streamline our activities. We will improve to 90% so that we will be able to make sure that we have safe clinical use of blood products. However, we would like to recognize the obstacles which exist, and we're talking about hemovigilance and pharmacovigilance systems. This is operational in some health units, but nevertheless, we are facing some constraints, particularly in terms of infrastructure and financing. Our country has a national blood policy, which is currently under revision and will be soon adopted. And this shows the commitment of our country and that we need to have a regulatory framework.
E convido os demais Estados a aprovarem as medidas contidas na proposta. Muito obrigado, Senhora Presidente.
Posted in this document. Thank you. Thank you.
Thank you very much. We have taken due note of the member states that raised their nameplates. It's getting late. People are tired. Some people have been here since morning. So we are going to adjourn and we resume tomorrow with the recent declarations, but rest assured that those who have raised their nameplates will be taken into account. So we have come to the end of our proceedings for today. We'll start tomorrow with a report on the Committee on Credentials, and this will start at 8:45. Thank you, everyone. You shouldn't leave there some housekeeping issues. That will be done by the secretary.
Honorable Ministers, distinguished delegates, just to let you know that there is going to be a cocktail, a cultural evening invited. You're invited to a cultural evening by the government of Zambia and the regional director of WHO immediately after this session. The ushers will guide you to the actual location. For the members of the Committee of Credential, we have a meeting immediately now, and it will be in room A08. So if you would like to come, we will guide you to where we're going to have the Credentials Committee. And we will we don't anticipate it being more than 20 minutes, even if. Tomorrow we will start, as the chair says. Tomorrow we will start at 8:45 with the report of the Committee of Credentials. Transportation, members, let me remind you of the members of the Committee of Credentials: Botswana, Burundi, Guinea-Bissau, Lesotho, Mozambique, Niger, and Uganda. The cocktail will be actually at this center, the Mulungushi Center, and all participants are invited. It will be held on the terrace in the front terrace as you came in. There will be transportation to the hotels at the end of the cocktail. The departure point is just in front of the conference center next to the actual cocktail venue. Shuttle services from the hotel to the Mulungushi Conference Center will depart tomorrow at 7 sharp. Thank you and have a good evening. Thank you very much.
Donc, bonne soirée à tous et la séance est levée.
The proceedings are adjourned. Have a good evening, everyone.
Experience the best of this week's stars on screen at the Stand Museum or to visual and local arts and overall and 5.9 and the